Again, class, when I talk about endocrine system, it would have several functions. One, it is in charge of your cellular interactions. It is also in charge with your metabolism, also in charge with growth, even with reproduction, the aging process, and response to adverse conditions. There are different neurotransmitters that are working hand in hand, class, for our endocrine system. One function, class, of your, or one example perhaps of your neurotransmitter that you can recall of is your epinephrine. If you would recall, class, your previous lessons, when I talk about epinephrine, what system does it trigger? Does it trigger your sympathetic nervous system or your parasympathetic nervous system? Students, epinephrine, very good. That would be able to trigger your sympathetic nervous system. Okay, class, it triggers your sympathetic nervous system. Now, what do I mean here? No? I mentioned earlier that when I talk about your endocrine system, it refers to glands of the body. Now, I've mentioned neurotransmitters. Your neurotransmitters is obviously part of your nervous system. But the point here, class, is that whenever the endocrine system would need help from the neurologic system, it will be the neurotransmitters that would be acting in behalf of the endocrine system in case the need would arise. Okay, so one example of your neurotransmitter, as mentioned, is your epinephrine, which would trigger your sympathetic nervous system or your fight or flight response. Now, your glands, students, are producing hormones. And when I talk about hormones, they are chemical transmitters. So these are chemical transmitter substances that would regulate and integrate body function by acting on either local or distant target sites. That's why later on, you would come to realize that even if the problem is on the thyroid gland itself, the problem would not be confined on the thyroid only, because we know that the thyroid gland could affect other parts of the body and the hormones could affect other parts of the body. Now, you have the following important parts that you need to remember. You have your hypothalamus, you also have your pituitary gland, and then you have the specific glands of your body. Now, students, your pituitary gland is commonly known as your hypophysis. Your pituitary gland is medically known as your hypophysis. Being the hypophysis, it is divided into two parts. Anatomically, it's divided into the anterior portion, and then you also have the posterior portion of your hypophysis. What's the medical term, guys, for the posterior portion of your pituitary gland? What's the medical term for the posterior portion of your pituitary gland? Neural, medyo malapit. Okay, very good. You have your neurohypothesis. Okay, class, it's referred to as your neurohypophysis. That's another name for your posterior posterior pituitary gland. Now, kung neurohypophysis ang posterior, anong tawag sa anterior? What do you call the anterior aspect of your pituitary gland? That would be your okay, adenohypophysis. Okay, very good. That would be your adenohypophysis. Now, your pituitary gland, as shown in an image there in your handout, would be producing a lot of hormones. But before the pituitary gland, who would trigger, guys? What organ of the body triggers the pituitary gland to release these hormones? What organ of the body would trigger the pituitary gland to release the hormones? Very good. That would be your hypothalamus. That's why, students, I had hypothalamus here on the list to remind you that the pituitary gland is releasing hormones based on the mandate of your hypothalamus. And then your pituitary gland would release the hormones to trigger the other glands of the body to produce the respective hormones. Now, you have the negative feedback mechanism. Negative feedback mechanism is an important mechanism in our body with the goal of equilibrium. Okay, with the goal of equilibrium. Now, who can explain to me briefly what happens in a negative feedback mechanism? What happens on a negative feedback mechanism? Sige, try kita explain what happens on a negative feedback mechanism. How is it able to maintain equilibrium? Is there anybody who would want to give it a try? Hindi na mag-chat kay mabudlay mag-explain sa chat. Okay. Yes. Anybody from the group? Okay. I'll call out names in random then if you don't want to. Abelio, April. Is April here? Not responding. Gerardo. Okay, Gerardo, I think I saw you raise your hand. Go ahead.
Yes, good afternoon, sir. So basically, sir, the negative feedback mechanisms tones down into one word. It's inhibition, sir. So sometimes because it leans towards homeostasis. Thus, if there is an abnormal increase in serum hormones, or I mean, if there are abnormal increase in hormones, it tends to have a negative feedback mechanisms where it inhibits the production of these kinds of hormones if it is abnormal.
Okay, I think we can capture those keywords that Gerardo has mentioned. So he has mentioned that it goes back to inhibition, and then he has also mentioned the term homeostasis. So class, as mentioned, the goal is equilibrium. Equilibrium can be likened to that of your homeostasis, which is a state of equilibrium. When we say homeostasis, we're talking about a state of equilibrium. And then he has mentioned about inhibition. He has mentioned about inhibition. In other words, guys, our endocrine system works in a way that whenever one hormone is increased, another hormone would try to contradict its effect. Okay, once the normal values have already been reached in the body. Or let's say, for example, let's take one example. Okay, we're talking about diabetes. I know most of you are familiar already with diabetes. So diabetes, okay, one problem that we have in diabetes is our blood sugar levels. Diba? Your blood sugar levels. Whenever, guys, your blood sugar levels are high, whenever your blood sugar levels are high, what hormone would be released by the body? Sige? Okay, of course, that would be your insulin. Okay, your body will be alert to release insulin because the body thinks, let's make use of that glucose. Let's make use of that glucose. And the goal of your insulin, students, is to decrease your blood sugar levels or your capillary blood glucose levels. Now, by the time that your blood sugar levels are already low, what hormone would be released by the body? Very good. You would have your glucagon. Okay? This time you would have your glucagon. Class, this is how a negative feedback mechanism works. Okay? Whenever class one hormone has already attained its intended effect, another hormone would be there to inhibit its effect. And the purpose of that is again to maintain homeostasis and balance. Now, understanding your negative feedback mechanism would be able to help us understand later on the different procedures or the different signs and symptoms that our patient is manifesting. Now, let's talk about MRI. These are just some of the diagnostic examinations that are used for your patients. Now, MRI and then CT scan, these are all imaging studies. If I would look at MRI and CT scan, to whom would I be worried about claustrophobia? On what cases or to whom would I be worried about claustrophobia? Will I be worried of claustrophobia in CT scan or in MRI? Claustrophobia. Ay, alert ka mo sa mga CT scan. Ha? Daw mga damo kita sa mga CT scan nga sa back. Class daw nagkulang ka mo sa Easter Sunday natin sina. Okay? When I say claustrophobia, it's fear of. Claustrophobia is fear of. Okay, fear of closed spaces. Now, if you would look at class between the CT scan and then MRI, who would become closed or tunnel-like? What would appear to be closed or tunnel-like? Students, okay, para nga clear kita. Okay, this is how your MRI machine would look like. Okay, this is how your MRI machine would look like. Okay, guys, kita nyo na ang MRI machine na it would appear to be a three-dimensional and then it would appear to be tunnel-like. That's why if your patient is claustrophobic, okay, you would need to pay particular attention if your patient would undergo MRI. Okay, please take note of that ha. Hindi lang ni applicable sa endocrine but also in several of your concepts. So you assess for your claustrophobia or fear of closed spaces. Now, if my patient is claustrophobic, do I need to cancel MRI? Do I need to cancel MRI? Okay, most of you are saying no. If no, what would be your alternative? What would be my remedy? Since by the time that my patient would enter MRI, okay, they would have fear. Very good. You administer your sedatives. If not your sedatives class, you administer also your anxiolytics. Okay, you administer your anxiolytics. Okay, so the main purpose again of your MRI is just to get an imaging study. CT scan, guys, would have the same purpose, imaging study, but your MRI would be more detailed compared to that of your CT scan. Now, if your patient students would be at risk for allergies, is allergy, di ba class, dua ka klase, no? MRI and CT scan would have two types. It could be plain, it could be with contrast. Again, class, for both CT scan and MRI, it could be plain, it could be with contrast. Now, if my patient will be undergoing a procedure with contrast, what type of substance do we inject to our patient? What type of substance is being used to our patient? Very good. That would be your iodine. And when I'm asking about iodine, your iodine is best contained in what food product? Iodine is best contained in what food product? Very good. That would be your seafood. Now, class, let's say, for example, your patient is allergic to seafood. What would I do? Do I need to cancel CT scan, or what type of medication do I need to prepare? Okay. Kay class, please take note of that if your patient will be undergoing CT scan, you don't need to cancel the procedure, but instead you can prepare your antihistamine, and then you can also prepare your steroids. One example of your systemic steroid students that you can prepare is your hydrocortisone. Okay? Most of you are mentioning antihistamine. Give me an example of an antihistamine that could be given to a patient with an allergic reaction. Give me an example of an antihistamine that could be given to a patient other than cetirizine. We don't usually use cetirizine for a severe allergic reaction. Very good on diphenhydramine. Okay, class, we usually use diphenhydramine because there is an IV preparation for your diphenhydramine. Okay, IV preparation for your diphenhydramine. Cetirizine was correct, but class, cetirizine is usually oral preparation. We use that for mild allergies. If your patient would have injections of contrast media, you would need an IV preparation to ensure that systemic reactions would be prevented. Okay, to ensure that systemic reactions would be prevented. Now, thyroid scan. Class, your thyroid scan would have these preparations included there. Important thing that you need to remember is to ensure that this procedure is performed first prior to any other contrast medium procedures. Why, class? Because those contrast media could be absorbed in your thyroid and could alter the results. Then you would say, class, expect discomfort or pain when the IV line is inserted. Usually, ang usual nga complaint, class, ng pasyente nga gina-inject ka natin sa contrast, they would say that there is warm feeling or daw naga-flashing. Okay, so don't tell your patient na hindi siya masakit because that's a lie. So you tell them that there's some discomfort and it could be warmth. No. Now, they could the duration would usually last for 30 to 60 minutes, and then they would have in supine position. What do you think, class? Ay na-indicate na dagali. So the purpose for increasing your oral fluid intake would be to eliminate the radionucleotide. Okay, class, the purpose is to eliminate the radionuclide substance which was used for thyroid scan. By the way, mabalik ko danay sa CT scan ha, kami nakasulat gali nga risk for AKI. What do you think is the meaning of AKI here? What do you think is the meaning of AKI here? Okay, so class, one of the problems if your patient will undergo a procedure with contrast is that they will be at risk for acute kidney injury. They will be at risk for acute kidney injury. Take note sa may contrast na niya. Kaya at risk sila, class, for acute kidney injury. What laboratory test do I need to take before I would need my patient to undergo CT scan with contrast? Very good. You would have your serum creatinine. Now, class, if the serum creatinine is slightly elevated, there is still a possibility that the CT scan with contrast would continue. Okay, it's not a complete contraindication. Kaya kung kailangan gidya ang imaging study, class, okay, it may continue. However, what medications do we need to prepare to reduce the risk of acute kidney injury? What medications can you prepare to reduce the risk of acute kidney injury? Very good on acetylcysteine, and name another medication. So, plus you have your NAC, you have your N-acetylcysteine, very good. And very good capture on sodium bicarbonate. Okay, class, so you need to prepare your NAC, N-acetylcysteine, and then your sodium bicarbonate. Okay, students, name a common brand of N-acetylcysteine. Name a common brand of N-acetylcysteine. Hmm, wala pa sila kasugata. Okay? Sige. Okay. Arang tama nga spelling class ng flumosil ha. Okay, you have your flumosil. Okay, a common that we use is your flumosil. Okay, your flumosil or your N-acetylcysteine, which is also the same as which is also used as an antidote for your acetaminophen toxicity. It also used as an antidote for your acetaminophen toxicity. Now, serum TSH, you have your thyroid stimulating hormone. Students, if I have a problem with the thyroid stimulating hormone, what organ of the body is probably the problem? Pag makita ko nga, oops, serum TSH is very high or very low, from what part of the body is my problem? Abtek kita magsabat sang thyroid. Okay, very good class. The problem could be in your pituitary gland. Okay, the problem, students, may be in your pituitary gland. But thyroid is also correct, guys. Okay, thyroid is also correct. Come to look at this, ano. If ever, class, your T3 and T4 is decreased, recall, class, that T3 and T4 are the hormones that are produced by your thyroid. Okay, if T3 and T4 is decreased, what gland of the body would tell the thyroid, hey thyroid, produce more T3 and T4? What gland of the body would tell the thyroid to produce more T3 and T4? That would go back to your, okay, that would go back to your pituitary gland. Okay, so let's look at an example where in class your thyroid gland is destroyed, your thyroid gland is not functioning properly. If your thyroid gland, let's say it's not functioning properly, T3 and T4 may be decreased. No, T3 and T4 may be decreased. With that, your pituitary gland will try to compensate. Your pituitary gland will try to release the thyrotropin releasing hormone to tell the thyroid, hey thyroid, do your job. Okay, hey thyroid, do your job. Okay, so from that, we can say that, okay, initially, pituitary base ang problem, pero on second thought, class, your thyroid could also be a problem why your serum TSH is affected. Okay, by the way, TRH, allow me to correct myself, is produced by the hypothalamus that would tell, class, your pituitary gland to release your TSH, to tell, class, your thyroid to release the T3 and T4. Okay, so class, you have your serum free T4, also measures your T4 levels. You also have your serum T3 and T4 that measures the protein-bound and free hormones that occur in response to your TSH secretions. Now, you have your thyroid antibodies. For your thyroid antibodies, students, it is also a blood test. Kag basta class maghambal ako nga antibodies, it is usually used to detect your immune disease. Okay, immune-related disorders such as your Graves' disease, your thyroiditis, and your Hashimoto's thyroiditis. These are all immune-mediated diseases. Now, radioactive iodine uptake. Class, your radioactive iodine uptake is intended to assess thyroid function and diagnose disorders such as hyperthyroidism and goiter. In other words, it's trying to check ano kadasig ang pagkuha sang thyroid sang iodine na ginhatag sa iya. Okay? So now, class, remember every time that you administer something IV to the patient, such as in the form of contrast, such as in the form of radioactive substances, you need to ensure that there is an informed consent. If you will be answering for the board examinations, sino class ang nagakuha sang informed consent? Is it the doctor or the nurse? Okay, very good. Be reminded lang, it is the physician's responsibility to get the informed consent. However, in real settings, okay, makita nyo lang na sa ulihi nga ang nurse class mismo nagakuha na lang sang informed consent, no, para magdasig ang obra. But you need to know that it is the responsibility of the physician. So again, may discomfort, tapos a pill will be administered orally, and then this could last for 15 to 30 minutes. But after the procedure, your nursing responsibilities is still to increase the oral fluid intake, resume the usual diet, cold compress, class, to reduce your discomfort or edema. Okay? Now, let's go to your clonidine suppression test. When I talk about clonidine, class, what's the effect of clonidine to our blood pressure? What's the effect of clonidine to our blood pressure? Okay, it decreases your blood pressure. And name a common brand name of your clonidine. Name a common brand name of your clonidine. Common brand name of clonidine. Very good class. That would be your cataplasm. Okay, that would be your cataplasm. Now, when I talk about pheochromocytoma, students, your clonidine suppression test is used for the diagnosis of your pheochromocytoma. Okay, used for the diagnosis of your pheochromocytoma. Your pheochromocytoma is the presence of your tumors class in your adrenal gland, which results to increased catecholamine levels. In other words, class, there will be excess innervation of your SIMPA nervous system. So your SIMPA class would be able to sige-sige function niya, sige-sige taas ang BP sang pasyente natin. Now, in your patients with your pheochromocytoma, once you administer class your clonidine, to a patient with pheochromocytoma, the result is that wala na ganubo ang BP sang pasyente. Okay, wala na ganubo ang BP sang pasyente. And that way you could say that your patient has pheochromocytoma. Okay, that's the function of your clonidine suppression test. If you would go back to pediatrics ng mga textbook, they would usually say that pheochromocytoma is characterized by an increase in blood pressure that is not responsive to the usual Okay. Am I audible, guys?
Yes, sir. Bago lang.
Yes, sir.
Nagbisyo.
Yes, sir.
May laki ginagwa nga warning. Okay? Nakuha niyo pa man ng pheochromocytoma, tama?
Yes, sir.
Yes, sir.
Now, class, your total plasma catecholamine concentration is also used to diagnose catecholamine secreting hormones or tumors. One example of your catecholamine secreting tumors would go back still to your pheochromocytoma. In other words, class, naga-increase lang gid ang catecholamines even though nga wala man kilanlanon ang body tani naton. Okay, so that's an investigation also, class, of your tumors. Now, what do we stop prior to the test? Amines, because that would result to false increase or false positive results. We also prevent self-prescribed medications or over-the-counter medications for 2 weeks. Bisan diin man lang class nga conditions ang pasyente ta, over-the-counter medications are not recommended. Plus, your methyl dopa is not recommended because part of it could be converted to dopamine, which could falsely increase also the results. The same class with your levodopa, which could be converted also to dopamine. By the way, levodopa is a drug of choice for what condition? Nadumduman ko lang, may levodopa. Very good class. It's drug of choice for Parkinson's disease. Okay, it's intended for Parkinson's disease. And then of course, students, your epinephrine. You know that epinephrine could trigger catecholamine release. So if you would be giving these medications, your result for total plasma catecholamine concentration would be falsely elevated. Okay, it could be falsely elevated. Now, excessive exercise and stress is also not recommended because it also triggers the release of your catecholamines. Then your patient is advised to have NPO, inform patient that they need to be kept warm and dressed for 45 to 60 minutes before the blood sample is collected. And then class, resume lang man diet after the procedure. Then class, you have your VAMA. We usually refer to this one as your VAMA, okay, your vanillyl mandelic acid test, which is the diagnosis also for your pheochromocytoma. So in this case, it still involves the measurement of your catecholamines after the administration of your vanillyl mandelic acid. Now, class, you have your dexamethasone suppression test. Your dexamethasone suppression test is intended to diagnose the pituitary and adrenal causes of Cushing syndrome. Okay? Now, kung nakabasa na kamo, your Cushing syndrome is characterized, students, by the increase of, quote-unquote, let's call them increase of steroids. Okay, we can call them the increase of your steroids in the body. In other words, class, increased production by the adrenal gland. Okay, there is exaggeration of the function of the adrenal gland. Now, among your patients with Cushing syndrome class, okay, para mabalaan kung anong cause, kay di ba na pwede nga ang problema ta pituitary, basi na tamaan ka excited si pituitary kag nag-release siya sa hormones to trigger the adrenal gland, or basi ang adrenal gland naton mismo nag-develop sang tumors, okay, which is releasing releasing these steroids. No? Now, what do? We administer dexamethasone orally at bedtime. And then class, you check the plasma cortisol levels in the AM, in morning, and then class, suppression of the cortisol level to less than 5 milligram per deciliter indicates that the hypothalamic pituitary adrenal axis is still functioning. Now, ari lang na class, again, di ba hambal naton, adrenal glands would produce your steroids. Adrenal glands produce your steroids. Okay, quote and quote ha, the natural steroids of our body. By the time class nga naghatag kita dexamethasone is also a steroid. What do you think class will happen to the production by the adrenal gland? Will the production increase or decrease? Will the production increase or decrease after muhatag dexamethasone? Waiting for your responses. Okay, so class ma-decrease siya because it knows na, oops, mayara na steroid na present sa lawas kay ini. Okay, so it would lower down the production of your steroids. Pag tomorrow morning class, pagkuha sang blood levels kag increased man gyapon, kay kag increased man gyapon students ang level sang aton nga steroids in the bloodstream, your corticoids in your bloodstream, your glucocorticoids, your mineralocorticoids, if they are still increased class, ibig sabihin wala naga-work ang pituitary axis, wala man naga-work class ang pituitary adrenal axis on the negative feedback mechanism. Okay, it does not work. That's why you need to do further testing. Now, you have your stimulation test and then your suppression test. So the explanation already there. So stimulation test to check for the hypofunction of an endocrine organ. Suppression test is to detect for the hyperfunction of a certain organ. So class, ano ginaobra sa stimulation test? The specific organ is being stimulated. Okay, for example, I would want to stimulate the pancreas. So matag kita sugar sa pasyente. And then after that class nga nagatag kita sugar sa pasyente, if wala nag-respond, okay, let's say for example, na, I administered the baseline blood sugar of the patient is 120 milligram per deciliter. I tried to administer 2 teaspoons of sugar. I tried to administer 2 teaspoons of sugar with the goal, supposedly, with the goal class that insulin production would increase. However, 2 hours after, kag nakita ko nga, oops, nag-increase pagit ang blood sugar sang pasyente ko, nag 150 milligram per deciliter. From that, I can conclude that there's a problem on insulin production. There's a problem in insulin production and my pancreas is not responding to the usual stimuli. Okay, that's how your stimulation test would work. Okay, suppression test, of course, would be the opposite way. For example naman sa suppression test, ano ganit class nga hormone ang nagapa-increase ang blood calcium levels naton? What hormone could increase our blood calcium levels? What hormone could increase our blood calcium levels? Ay, wala na may sabat. Okay, very good. That would be your PTH. Okay, so class, for example, I would want to test the functioning of the parathyroid hormone. No? I would want to test the functioning of the parathyroid gland. What I would be doing is that, sige, suppression test na. Class, try ko pataason ang calcium. Tagaan ko si patient, okay, give patient milk, or give patient calcium supplements. After some time, let's say after 6 hours, for example, I will be testing ano na natabo sa PTH. Supposedly guys, kay nagdamo ang calcium sa lawas, ano dapat ang normal nga matabo sa PTH levels? Would it increase or decrease? Taas ng calcium. So ano dapat ang matabo sa iya? Dapat mag-decrease siya guys. But after some time, kung wala man siya gyapon nag-decrease, meaning there's a problem. There's a problem with the way that the parathyroid gland is functioning. Okay? It again goes back to your negative feedback mechanism. Okay? It goes back to your negative feedback mechanism. Now, let's look at this image of your pituitary gland. I actually retrieved this from Brunner and Sudar. Class, this would remind you that there are only 2 hormones that are released from the posterior pituitary gland. The 2 hormones are namely your, kung gusto nyo siya class madumduman, you could remember that as OA. Okay, the posterior pituitary gland would release your OA. So you have your oxytocin, and then the other one is your anti-diuretic hormone. Okay, your ADH. Another name for your ADH is vasopressin. Okay, vasopressin as indicated on the picture. In class, this picture could paint 1,000 words, literally. So I hope that you'll go through the picture. Look at this. ADH is acting on your kidney. Okay, your oxytocin acts on the uterus of the ladies. It also acts on the breast. Okay, now, since we've mentioned breast and oxytocin, no? And then class, if you've noticed, prolactin is also acting on the breast. Between the two, what is in charge of milk production? Is it the oxytocin or the prolactin? Okay, students, very good. That will be your prolactin that will be in charge of your milk production. On the other hand, kung milk production, siya ano yung function ni oxytocin related to breast milk. Okay, very good. Okay, it's intended for letdown. Okay, it is intended for letdown. Okay, so tanawa, ADH would act on the kidney. Your growth hormone class would act on your bone and soft tissues. So class, your growth hormone could make you tall, could make you, if kulang siya, that would result to dwarfism. What do you call that specific part of the bone? What do you call that specific part of the bone that allows for growth? Ano nga parts ng bone nato na nag-allow nga magtaas kita? Wala na, isa lang gid. Tapos may question mark pa. Hindi na ako magbaton so may question mark nga sabat sa sunod para nga may feeling of certainty na kamo dapat. Okay, very good. That will be your epiphyseal plates. Okay, that would be your epiphyseal plates or your epiphysis. Okay, that would be your epiphysis. So class, your epiphysis of the long bones would allow for the growth, no? Would allow for the growth of your bones. Now, after puberty, your epiphyseal plates are actually expected to be closed. So ang growth hormone natin, wala na masyado may mabulig class. Ang bulig yan na upon adulthood is more on glucose metabolism and not anymore on the growth of the patient. Now you have your ACTH, amo ni siyang ga-trigger sa aton nga adrenal gland, specifically your adrenal cortex to release your corticosteroids. You have your TSH to trigger thyroid gland, FSH and LH to trigger your testes class and also your ovary for that matter. These are concepts in your maternal and child nursing. So you have testosterone, estrogen, and progesterone. Pero matouch naman na siya gapon karon sa aton nga calcium. Now, assessment, no? Sorry, wala nadala si hypopituitarism. Hypopituitarism. Sapat. Hypopituitarism. Now guys, if your patient, the common etiology indicated there are tumors, trauma, encephalitis, autoimmune, or it could be also stroke. So class, kung common tong, ang pinaka-common gid na actually is tumor, no? Mga problema. That's why oftentimes there is removal of the pituitary gland that is done to our patients. Now assessment, kung kulang ang functioning sa aton pituitary gland, a lot of things could happen to our patient. Mild to moderate obesity may occur. Mild to moderate obesity may occur. Guys, anong hormone matchad nyo? Dito kang ginasababaw. Ang nagkulang, nga ang nag-mild to moderate obesity ang aton patient. Pili ka mo dira sa growth hormone, ACTH, TSH, FSH, LH, prolactin. What hormones were lacking nga nag-mild, or ano nga hormones ang nagsubra nga nag-mild to moderate obesity ang aton patient? TSH, maliban sa TSH. Tama ang TSH. Hindi magduwa-duwa pindot sa TSH. Maliban sa TSH, ano pa gid nga hormone? ACTH. Okay, may leptin na silang nalalaman. Ano pa? Among the hormones released by your pituitary gland muna. Class, it could be that there is an excess of your growth hormone. And in terms of TSH, ano ay natabo? Nag-increase ang TSH or nag-decrease? In terms of TSH, nag-increase siya or nag-decrease? Okay, in your TSH students, there may be a decrease, okay, that led to your obesity. Okay? Now, reduced cardiac output. Nagamay ang cardiac output. What hormone could have attributed to this? What hormone is defective that led to the reduced cardiac output? Okay, so may moment of silence. Kita kung anong nagpa-reduce ng cardiac output. Okay, people have mentioned ACTH. Sige, batunon ko ang ACTH, but what's the rationale? ACTH would trigger the release of what hormone? ACTH would trigger the release of what hormone?
Adrenal cortical.
Okay, you're mentioning your adrenal corticosteroids. Other than that, ano nga specific na corticosteroid ang ginarelease niya? Di ba may tatlo na siya? May mineralocorticoid, may glucocorticoid, kag you have your androgens. Okay, somebody has already mentioned it. That will be your aldosterone. Okay, you have your aldosterone. Okay, your aldosterone, which is a mineralocorticoid. So tama to siya guys ha, nag-release siya ng adrenocorticosteroids, specifically your aldosterone. And what does your aldosterone do na may labot sa cardiac output? What will your aldosterone do that has something to do with the cardiac output? Okay, very good class. Water retention. Okay? Okay? Mas very good ang nagsabat sa salt and water retention. Okay, salt and water retention. That's the goal of your aldosterone. Kag kung nag-increase, kag nag-water retention kita class, there is increase of blood volume. And because of the increase of blood volume, there will of course be an increase of your cardiac output. Okay? Nga very good class ang salt and water retention because the salt part here is actually the one that differentiates your aldosterone from your ADH. Your antidiuretic hormone is also doing water retention. So class, the one that differentiates the function of your aldosterone and your ADH is that aldosterone would have sodium and water retention. On the other hand, class, your ADH would only have water retention. Okay, aldosterone again, sodium and water. However, class ADH, water retention only. Okay, balikan na kita, reduced cardiac output. Now, ano pagit? Ginbaton ko ni kang ginang ACTH. May nagsabat na kang ginaklas ang isa kasabat na gina-expect ko is your antidiuretic hormone. Okay, it goes back to the reason nga, oops, there will be water retention and then the cardiac output would also be improved. Okay, what else? Ano pagidayan nga hormone ang pwede maka-improve or maka-reduce sa nga nga cardiac output? Hormone lang danay sa pituitary gland. What else among the hormones mentioned there could improve or reduce your cardiac output? Ano niya hormone that can increase cardiac output? Alang-alang pag-search natin. No? Kay class, pakadlaw si Liz. Okay, that would be your growth hormone. Ha? Your growth hormone would also some effect. Kung i-analyze nato ng TSH nyo, yes, pwede ko man siya mabaton. No? May effect man siya gapo. Okay? Now, let's go towards your infertility and sexual dysfunction. If I would look at this, okay, if I would look at all the hormones listed dira sa diagram ni Brunner, what hormones could have led to infertility and sexual dysfunction? Ano nga hormonal problem? Okay, very good. You have your LH, you have your FSH. Maliban dira, okay? Now, clue, I would give you the 3S, the salt, sex, and sugar. If I would talk about salt, sex, and sugar, what hormone am I referring to? Okay, very good. Okay, class, your ACTH. So when I talk about infertility and sexual dysfunction, other than the LH and the FSH, you also consider students your ACTH. Okay, your ACTH, guys, which would trigger the adrenal gland to release the 3 types of steroids that would be in charge of your salt, sex, and sugar. And for the sex part there, ano nga component or ano na gani nga klase ang adrenocorticosteroids, ang sex nga ni class? That would be your, okay, very good. That would be your androgens. Okay, that would be your androgens. Now, patient comes to you complaining of fatigue and low blood pressure. What possible hormones is your problem? Dali lang gid ko yan nurse makapoy, tapos lubo pa yung BP. What hormones would be possibly the problem? Damo, no? Damo gasulod sa isip nyo, no? Kay class, TSH could be one. Okay? Panumduma, hyperthyroidism, they would be have heat intolerance. Hypothyroidism naman class, easy fatigability. TSH would be one. Then you also class have your antidiuretic hormone. Because remember, what is the relationship? What is the relationship between your blood volume and the BP? Is it a direct relationship or an indirect relationship? blood volume and BP, class, would have direct relationship. Whenever the blood volume is increased, the BP is also increased. So pag may problema ko sa ADH, I'm sure magka-problema man ako gyapon sa blood pressure sa pasyente. Okay, since the istoryahan fluids, you know that ACTH would come into picture because aldosterone is there. And then another class that you can consider is the growth hormone still. Okay, now, headache and visual defects. Class, the headache and visual defects is actually congruent na or dependent on the location of the tumor. Okay, that would depend on the location of the tumor. So usually, no, mambal ng pasyente nga, daw, pero may sakit akon ulo ha. Tapos bisan ipahuway niya, daw wala gyapon. Tapos kung tanawon ang iya mga routine nga blood test, let's say for example, CBC, wala man mga problema. Because the next thing that you can explore is the possibility of the presence of the tumor in the cranial cavity. Okay, so headache and visual defects are already related to the location of the tumor. So what would be our plan of care for this patient? Hormone replacement. Okay, emotional support will be there and allow verbalization of feelings. Guys, oftentimes nga daan, they have a tendency, no? They will have a tendency to curse. No? Why is it of all people sa akon panatabo? Nga ang ako pang nag-dwarfism, nga sa ako natabo ang gigantism, nga sa ako natabo ang acromegaly. Okay, so they will have a tendency to do that. So kita as nurses, you don't just focus on the physical aspect, but you also consider the emotional aspect of care that is being given to the patient. Now, hyperpituitarism. So class, you have there benign pituitary adenoma. That's one of the reasons, class, of your hyperpituitarism. Then another that you can have is, you have your prolactinomas. Class, your prolactinomas, of course, the excess secretion of your prolactin. Okay, excess secretions of your prolactin. That's 60 to 80% of the cases. Now, you have large hand and feet, no? Hyperpituitarism. Kung nagdako class ang hand and feet sang isa ko kapasyente nga may hyperpituitarism, pero ang height niya, guys, amugyapon, what condition am I exploring? Okay, very good. That will be your acromegaly. Okay, that would be your acromegaly. Okay, class, take note of that ha. Isa ka characteristics ng acromegaly is that nagdako ang iya extremities. However, the height of the patient remains to be the same. No? Okay, so acromegaly. Kung tanan nagtaas ang pasyente, naglaba kamotya, naglaba mantiilya, you're considering gigantism. Okay, you're considering gigantism. Now, with that being said, diin ayhan class ang common matabo or would have an onset in pediatrics. Acromegaly or gigantism. Nagtaas ang pasyente, naglaba patiil niya, naglaba kamot niya. Okay? What would have a common onset class in pediatrics? That would be your gigantism. Okay? That would be in your pediatrics. Okay? Kaya again, ang epiphyseal plates nyo, bukas pa. But in your acromegaly, guys, your acromegaly would usually have adult onset. In other words, nagtaas ang aton growth hormone, nagtaas aton tuod nga growth hormone, pero it's too late na para magtaas ikaw. Okay, what happens is that nagdako lang imo nga extremities. Okay, class, if tanawon yung acromegaly, it's not even lengthening of the extremities, nagdako lang gid yung extremities nila. All of these signs and symptoms here, large hands and feet, thickening protrusion of the jaw. Okay, you'll also have your arthritic changes and joint pain. And then impingement syndrome. Impingement class meaning there is compression of the nerves secondary to the enlargement of the surrounding tissues. Okay, these are all indications of your acromegaly. Okay, these are all indications of your acromegaly. Now, class, your hypertension, atherosclerosis, cardiomegaly, and heart failure could be an indication of an excess of what hormone? Hypertensive ang pasyente. Okay, iduaway tanay sa atherosclerosis. Hypertensive, cardiomegaly, kag heart failure. Ano ayan class nga hormone ang nagralapaw pagid sa pasyente ko? Maliban sa growth hormone ha, because this could also be consistent with growth hormone. Maliban dira class, ano pagid ang naglapaw? Very good. Okay, it could be nga nag-increase pagid kita sa ACTH kag ADH production. Okay, ACTH and ADH production. Now, these are still signs of acromegaly that we're talking about: dysphagia, deepening of voice, thickening of tongue, narrowing of airway, and even class the incidence of sleep apnea. Oftentimes, we refer to it as your OSA or obstructive sleep apnea. Okay, so you have your obstructive sleep apnea. Okay, tama man, may nag-mention ng TSH. So yeah, this could be possibly brought to you also by your TSH. Because again, we're talking about hyperpituitarism, okay, meaning class pag-exaggerate sa functioning sa ating pituitary gland. Now, if the hypothalamus is already involved, no, you would have problems with sleep, you will also have problems with temperature regulation, and even class your appetite. Kaya remember kung pamangkuton kita, what is the center for what is the thermoregulatory center of the brain? Okay, class, that would be your hypothalamus. If you would be asked, what is the satiety center of the brain? Okay, satiety, mabalaan ta kung busog kita, class, that is still your hypothalamus. So that's why appetite will be there. Okay, your thermoregulatory class, your temperature will also be there. So these are the centers, no? These are the centers of your ano tawag na gani, hypothalamus. So even emotional balance class has something to do with your hypothalamus. Now, if the condition of the patient is hyperpituitarism, okay, management, you could have your radiation. Okay, you could have class radiation, that's a focus radiation going towards your pituitary gland. Or you could also have your stereotactics, radiosurgery. And then class, we could have your hypophysectomy. As the term ectomy would imply, that would entail class the removal, of your pituitary gland. Okay, entail the removal of your pituitary gland. Now, you have several options in your hypophysectomy or the removal of your pituitary gland. It could be craniotomy, it could be sublabial, transphenoidal, endoscopic, transnasal approach, or yeah, those are the two options that you have. Once does your patient have undergone craniotomy, obviously magambala ko guys na craniotomy, nag-open din kita sa cranium, no? These are the complications that we need to watch out for after the surgery. One is increased ICP, second is bleeding, third is meningitis, and then hypopituitarism. Now, increased ICP. Guys, paano ko mabalaan nga nag-increase ang ICP sa pasyente ko? Or first, nakadiscuss na ka mo neuro, wala pa? I think wala pa.
Not
Okay,
yet,
wala.
sir.
Okay, yeah. Okay, ICP. ICP class stands for, let's try it. This has been tackled in health assessment, so I think some of you would have an idea. Very good class. That will be your intracranial pressure. So class, when I talk about your intracranial pressure, students, may ginatawag kita dira nga Monro-Kelly hypothesis. No? So you have your Monro-Kelly hypothesis. Magambala ko guys nga Monro-Kelly hypothesis, siling students ni Monro-Kelly hypothesis, there are three incompressible areas or tissues in our brain. Ano inang tatlo ka incompressible class? You have your brain, then you have your blood, and then you have your CSF. Okay? Sila nga tatlo guys ang parts ng inyong intracranial pressure. Ano hambal ni Monro-Kelly hypothesis or Monro-Kelly doctrine? Whenever students, there will be a problem. Let's say for example, nag-swell ang brain. Kung nag-swell ang brain guys, wala kita choice but ma-adjust ang iban nga parts because the brain or the cranium itself could not adjust in size because that's a bone. Hindi man pwede nga padakoon ng cranium kaya nagdako ang pressure sa sulod. So whenever class, for example, nagtaas ang pressure sa brain, wala tayong magagawa. Si blood at saka si CSF class mag-a-adjust. Okay? But then it will come to a point that the adjustment would fail. And then class, once the adjustment would fail, that's the time that your intracranial pressure would start increasing. Okay, that's the time class that the signs and symptoms of your increased intracranial pressure would ensue. Sige, matsyag naton. Hambal ta diba? So for example, tagaan kamo situation ng pasyente naton had undergone. By the way, I have not asked, do I have PhilAm students here who could not understand Hiligaynon? Or could I go with Hiligaynon? Kasi karo kay Hiligaynon, kundi kag may mga PhilAm ko gali pala. Do we have PhilAm students? Wala man. Am I good with Hiligaynon, guys? Okay, sige. Hambalan niyo ko karon ha, kay at least makabulos-bulos lang ko Hiligaynon kag English. Kay do kasulumuod man nga mapuro lang kita English. Okay? Sige. Now, where were we? So class, for example, your patient have undergone removal of the pituitary gland. Tapos, you're informed, hey, monitor for increased ICP. Ano ang signs and symptoms nga bantayan naton? What's the first sign of increased ICP, guys? Okay, where are we? Blurred vision, irregular respiration, headache, ito syempre ulo, class mo no, headache, okay? What else? Daw medyo gaalang-alang pa nga itong mga sabat. It's okay. Cushing triad, I appreciate that you can recall Cushing triad already. Very good on the change in mental status. Okay? To be more accurate on the statement, class, altered level of consciousness. Okay, altered level of consciousness. Very good also on disorientation and confusion. Ang muna class ang pwede matabo sa pasyente natin. Okay? So class, kung nag-increase ang ICP, the first sign perhaps is altered level of consciousness. Kung pamangkuton ka mo kung anong mga signs ng altered level of consciousness, irritability. Yeah, may lang gaugtas. And then class, next is confusion. That's very good. And then class, you will have disorientation. Okay, disorientation. These are the probable signs that your patient is already having increased intracranial pressure. Disorientation. Magambal ako class ng orientation. What are the 4 areas in orientation that I assess? What are the 4 areas in orientation that I assess? Okay, time. Buka kadasig niya mag-type sang isa. Kumplito yun na tayo ng 4. Very good. Okay, so class, you have your person, place, then you have your time, and then the 4th one, they say purpose, or you can have situation. Okay, so you can have purpose or situation. So kadasig ito yung mag-type. Okay, so class, purpose. A person, I mean, sino nitupad ko? Place, diin kita subong, ma'am. Ano oras subong? Kag nga aari kita diri. If tama ang sabat niya dira, class, your patient is oriented. But if mali ang sabat niya, class, either isa dira, you need to re-verify, and your patient could be classified as disoriented already. Okay? That's how it works. Now, bleeding. So, bleeding, makita ta na iya. No, makita na nato ng bleeding. So, one thing that you can look into is the bleeding on the surgical site. If not, class, the bleeding on the surgical site, you watch out for periorbital ecchymosis. So nang tawon yung class ang mata sang pasyente sa palibot sang mata niya, kung may makita ka mga oops nga ano nga ito nga daw sinumbag nga daw lagob, that's an indication class that there's an internal bleeding going on. Okay, they would say, others would say raccoon's eye. So kung class, kung may presence of raccoon's eye, that's an indication of bleeding. That's in fact an indication of basilar skull fracture again. Tapos class, is may bleeding man kita diri nga makita, no? Okay, there is an ecchymosis on this part. So you need to watch out, no, kung where's the bleeding is coming from. Now, meningitis. Meningitis would mean infection. Class, what do you think? Kung after craniotomy ang pasyente naton nga ginkuhaan sang pituitary gland, ano ayan ang una ta makita? Will we see increased ICP first or will we see meningitis first? Bago lang siya operahan, do mga 1 day pa lang, no? Ano ang una nga complication nga makita natin? Yes, guys, mauna na yung increased ICP. Okay? Ang meningitis natin nga to, guys, natabo lang to siya because there might be a breach on the sterile technique. Okay? Or di natin malikawan, there's a skin contact, okay? Higko ang pagdressing in the sterile technique, so there is a breach on the sterility that led plus to the infection meningitis. Now, what are the 2 signs? May ngalan gid niyang signs ng meningitis. So magambal kita meningitis briefly, that's irritation of your meninges. Meninges is the tissue that surrounds your brain, no? Now, what are the 2 signs? Yeah, local rigidity is part of it. Okay? Pero may duha na siya class ka sign. Ang isa nag-start sa letter K, nalipat ko gani isang isa. Ang isa nag-start sa letter B. Okay, ang isa nag-start sa letter B. Very good capture on Koenig sign. So you have your Koenig sign. And then another one is very good on Brudzinski. Okay, so these are the signs class of your meningitis. Okay? Or kung tulukon ko ang vital signs, matsyag nyo, anong madakpan ko sa vital signs kung ang pasyente ko may meningitis? Fever. Okay, as simple as fever. Okay, that's why di ka mo magambala, hilanat lang na, basi natugnaw-tugnawan lang na. No, class. So it might be already an indication that your patient is having meningitis or basi na tandog ang hypothalamus during the surgery that might have led to that problem. Okay? Then you have hypopituitarism. Amo ning problema Kang gina problema naton excess ang iya functioning. Hyper siya. So anay nga kwaon ta siya, hypopituitarism naman ta. With hypopituitarism students, you would need a lifetime maintenance. No? You would need a lifetime maintenance. Ano kinahanglan ta i-maintain? Damo, thyroid hormone mo, okay? Some of your steroids, okay, for your adrenal gland. Basically, all the hormones that will be affected by the removal of your pituitary gland. Okay? Now, on your sublabial transphenoidal endoscopic transnasal approach, class amo ni siyang picture, dili nga ginkurisan ko ha. Okay, I'm so sorry for the kuris-kuris on the picture. Okay, so class amo na siyang gigapakita tani sang transphenoidal approach naton, no. Okay, that's the one that appears to have your your transphenoidal approach. Kung makita nyo class, dako lang na nga scope ipasulod sang doctor, that will be passing on your sa roof sang mouth natin, tawag na natin. There's a term for that. Palat. Okay, you have your soft palat and your hard palat. Okay? So, ipapass through lang the class until nga ma-capture natin class ang imong pituitary gland. Okay, the doctor of course is doing that. Now, what are the areas that you need to check no after the surgery? So class, you have your CSF leakage. Okay, one class is your CSF leakage. So, paano kung mabalaan nga may CSF leakage? Okay, halo sign. Very good, class. Your halo sign. So you would look at the gauze. Let's say, for example, may nagwa abi class, no? May nagwa class sa iya nga ilong. Very good. You mentioned otorrhea and rhinorrhea. So class, magambal kita otorrhea, may nagwa sa dalunggan ng pasyente. May nagwa din class sa ilong for rhinorrhea. How would I know that there is presence of CSF? Kiti class ang nagwa, pwede man na yung sipon, pwede man na yung plemas, pwede man na yung bulaho niya class. So how would I know that there is presence of your CSF? So very good answers there. If you would have the gauze, you would look into the halo sign. Magambal ka mo nga halo sign class, kung amo ni ang fluid nga ginbutang mo, dugay-dugay maamat-amat na siya laptado, may halo nga nagapalipot. And then very good, you would check for the presence of glucose. Nga class ang CSF naton, ano siya sa glucose? High or low? Okay, your CSF would have high or low levels of glucose. Ay, wala naman kasabat how. Okay, there would be high levels of glucose for your CSF. Okay, so class, basta may nag-post up ang pasyente, pagkatapos glucose levels are increased, you would suspect students that there will be, I'm so sorry for the interruption. There will be, where are we? Sapad so nag-call sa akon. So class, kung may glucose nga pasyente, that you would suspect that that's your CSF that is leaking. Okay, there is leakage of your CSF. Infection, ang momento gyapon class, fever. Okay, fever. Anong DI? What's DI? What's DI? Okay, so you have class your diabetes insipidus. Okay, you would have your diabetes insipidus, which is characterized by anong nagkulang ang hormone dire? Ano ang nagkulang ang hormone? Okay, very good. That's the kulang of your ADH. And then of course, class, hypopituitarism. Okay, so you have postcranial care. Vital signs would be checked. Neurovital signs would be checked. The level of consciousness would also be checked. Now, for the neurovital signs, sorry sang ADH. Okay, class, for the neurovital signs, the number one tool that you use is your GCS. Just as a quick recap for your GCS, what's the perfect score, students, for your GCS? 15. And the lowest score for your GCS is 3. Okay, what are the 3 areas that we assess for your GCS? E, V, and M. Okay, eye opening, then you have your verbal, and then your motors. Class, memorize nyo na nga EVM para hindi na kamuayawan magpasunod sa 4, 5, and 6. Eyes, perfect score is 4, verbal, perfect score is 5, motors, 6, total of 15. Lowest score for each is 111, that's why lowest is 3. Okay, let's reserve that to your neuro. Tapos elevate head of bed class. The purpose of elevation of the head of bed is to facilitate drainage, no? Facilitate drainage of the excess fluids. Kaya the class, bago lang kita ginoperahan, kaya the tendency is that there will be swelling, no, on that part of the brain that was touched. So class, to facilitate drainage, kina-elevate ang head of bed. But when you are caring with a neurologic patient, hindi man pwede nga tamaan kataas ang elevation sa head of the bed because class there will be a tendency for brainstem herniation if there is increased ICP. So usually we are placing it as 30 degrees. We are placing it at 30 degrees for that matter. Now, class, bakit bawal mag-sneezing, coughing, kag-blowing of the nose? Very good. It increases your ICP. It would increase your ICP. O, te, magambal ang pasyente. Daw mga tsi na gid siya yabi class, tapos sa tubang mo gahana na siya nga mga tsi siya. What would you do? Okay, very good class. The open mouth. Te ko ang pasyente abi may COVID. Mga nag-ipos na sila. Okay, class, kung hindi gid class mapunggan ha. Okay, so you try to have, you tell your patient to do it in an open mouth. Okay. Okay, kung ang pasyente class may COVID, kamo na da pangitapag, pwede man nga patchihon mo na siya dalagan kada na ipagwa. Okay, para hindi kaya malatnan sang COVID niya. Kay open mouth class para ang pressure dira magwa kag hindi nga mag-increase sa class sa ulo naton. Monitor for signs of increased ICP na istoryahan ta na kanina. Monitor for temporary DI class, temporary diabetes insipidus. So there will be fluid retention. There will be excess. Ano ga katabo sa DI? Nagagwa ang fluids or nagastay sa lawas? Okay, nagagwa ha. There will be excess fluid excretion. Okay? In other words, class, for example, no, may pasyente ka nga na, for example, may ara ikaw pasyente nga, what do you call this? Nag-undergo sang pituitary gland removal. Pagkatapos class, after the surgery, ang iyang urine output tag 500 ml per hour. Okay, you would suspect what complication? That will be your diabetes insipidus. Okay, so commonly class, ang una yan ang signal, ang urine output class tag 900 ml per 2 hours. Okay, tapos class, the urine specific gravity. If nag-explore kita students sang diabetes insipidus, what happens on the urine specific gravity? Would it be increased or decreased? Okay, very good class. The urine specific gravity would be low. Okay, because class, you have a lot of urine and the urine would become diluted. Okay, the urine would have a tendency to be diluted. Okay, so pituitary gland is removed. Wala kita muna toothbrushing. Okay, because class, your toothbrushing could in fact magubaya bala class ang stitches to naton kang gina sa aton nga transphenoidal approach. And then class, you check for CSF drainage. So we mentioned about CSF drainage earlier, so your halo sign. Okay, by the way, looking at the two surgeries, who would have fewer complications? Will it be the craniotomy or the transphenoidal approach? Which do you think would have fewer complications? Will it be the craniotomy or the transphenoidal approach? 5, 4, 3, 2. Budlay spell ang transphenoidal, no? Balik-balikan nyo pa, no? Okay, class, it will be your transphenoidal approach. Okay, it would have fewer complications, ha? Okay, amo na nga ang trend subong class kung mag-removal sa pituitary gland is your transphenoidal approach. Okay. Oh, ano na tabo sa akong table dire. Now, let's go on the hormones of your pituitary gland. Okay? Now, the first hormone there on your list is your growth hormone. What's another name, class, for your growth hormone? What's another name for your growth hormone? Very good, class. You have your somatostatin. Okay, another name for your growth hormone is somatostatin. Pangtandaan nyo ng another name kaya very familiar kamo sina tapos malimtan ninyo. Now, what is the function of your growth hormone? Of course, class, it would be leading to growth of cells. Okay, you have the growth of cells, you have the growth of your bones, you have the growth of your soft tissues. And then it could also affect students, your carbohydrates. It could also affect your protein metabolism and even class your fat metabolism. Okay? Class, ano ginaubra niya sa blood glucose levels? It increases the blood glucose levels. Gusto niya grow. Gusto niya class i-increase ang blood glucose levels. Now, since gina-increase niya ang blood glucose levels, what do you think? Is it an insulin agonist or insulin antagonist? Gina-increase niya ang blood glucose levels. Is it an insulin agonist or antagonist? Auto-divided ang buto ta subunghaw. Oh my God, bulos-bulos. Okay, bulos-bulos ng kamusabat. Okay, class, it's an insulin antagonist. In other words, class, it also combats the effect of your insulin. Okay, it also combats the effect of your insulin. Ay, nagkakautod ang akong nga table. So for this one, guys, you have your gigantism. So your gigantism is characterized by hypersecretion of your growth hormone. Okay, as mentioned, takanggina class, your gigantism happens during pediatrics prior to the closure. It happens in pediatrics prior to the closure of your epiphyseal plates. Prior to closure of epiphyseal plates. Okay? Dali lang, daw wrong spelling ang akon nga epiphyseal plates. E-P-I-P-H-Y. Okay, dala ako nagsala. S-E-A-L. Epiphyseal plates. Okay? Now, ano makita ta diri class? Very tall patients. So there is an exaggeration of the height and then the weight of your patient. Exaggeration of the height and then the weight of your patient. Now, acromegaly. Class acromegaly, namit lang tanakangina, there is hypersecretion in adults. Okay? After na mag-close ang epiphyseal plates. After the closure of your epiphyseal plates. That's why kung titingnan natin sila guys, they would have jaw protrusion, they would have arthritic changes, okay, they would have diaphoresis, oily skin, and hypertension. Isa pa gila nila ka-manifestation, or no, common man nga cause ni students is tumors. Well, it all goes back to tumors no, when it comes to pituitary glands. Drug of choice for this condition is your bromocriptine. Drug of choice for this condition is your bromocriptine. Now, dwarfism. The deficiency class of your growth hormone is referred to as your dwarfism. For the management of dwarfism, I'm not privy ko ano subong ang updates. But class, for your dwarfism, there was a time that I've read about triggering the epiphyseal plates class to open. So what they do is that there's a ginaobras ng orthopedic is that gina-open ang epiphyseal plates or ang ends ng bone class gina-scrap off para nga matagaan opportunity to grow. But I have looked for it in some MS books. It is not yet discussed. No? Buwan na gali sila class is induced fracture. What they do is they induced fracture in such a way that it will trigger bone growth. Tapos class, meaning ginkat niya hungod ang bone, tapos ginabutangan siya students ng mga pins and rods para nga daw mabutong siya bala. Okay, that would hopefully increase the height of the patient. But so far, MS books are silent about it. So I concluded that it's not yet strongly recommended. So prolactin guys, you have galactorrhea. So galactorrhea is excessive milk production. Ibig sabihin, bisan wala siya sang bata, the patient is not lactating, but then the patient would have excess milk production. So drug of choice guys is still your bromocriptine. Then you have your ACTH. So it's referred to as secondary Cushing's disease because class kung ang problema naton ara sa pituitary gland, it's a secondary problem. Pero kung ang problema naton guys is ara sa inyong adrenal gland, that will be a primary problem. Okay? Secondary kay siya kay because, okay, nag-decrease ang production ng adrenal gland because the pituitary gland failed to trigger the adrenal gland to do so. So that's why may ara ka mo secondary Cushing's disease, secondary Addison's disease. The same for your TSH, secondary hyperthyroidism, secondary hypothyroidism. Now, FSH and LH, class so it is in charge of your secondary sex characteristics. Whenever there will be an increase, whenever there will be an increase of these hormones class, there could be precocious puberty on the part of your patient. Whereas kung mag-decrease yun ng hormone, mga bakit class precocious, meaning do ka-early pa na-develop yun ang secondary sex characteristics niya. Do elementary pa lang siya class, makita mo nga, wow, nagadako na iya kalawasan, nagadako na iya boobs class, nagalapad na iya abaga, kay among males. No? Now, so precocious puberty. What happens in decreased? So there is failure to develop your secondary sex characteristics. Example, kung sa lalaki, small penis, testicles, no body hair, decreased libido. In your female, failure to develop breast, no body hair, no ovulation, no menstruation, and even infertility. Now, class, for your MSH is your melanocyte-stimulating hormone. It is in charge, class, of your skin pigmentation and even your retinal pigmentation. So pag mag-itom, if there is excess class, there is hyperpigmentation, tawag na nila class eternal tan. Pero pang habang buhay na class na may tan ikaw dira. But its deficiency is referred to as albinism. And what could possibly happen, class? If your patient is exposed in daytime vision, what do you think? Will they be able to tolerate daytime vision or will they not? Class, take note ha, nag-decrease, no? Mag-decrease ang pigmentation sa retina. Okay, class, they will have difficulty to tolerate your daytime vision. Okay, they will have difficulty to tolerate your daytime vision. Then class, they will not be able to tolerate the presence of your bright light. Okay, that's it for your pituitary. Then you have your ADH there, class, your vasopressin, which will be our next topic. No? So you have your SIAD and your diabetes insipidus. Okay, diabetes insipidus and okay, guys, let's have a break. Will 10-minute break do for everybody? Okay, class, so let's talk about your diabetes insipidus and your SIADH, no? Or commonly we say SIAD. Now, looking at diabetes insipidus, there are two possible causes. You have your neurogenic DI, and then you also have your nephrogenic DI. Just get it from the name, neuro. The problem is on the brain. Then you have your nephro class. The problem is on the kidney. In other words, the ADH, the antidiuretic hormone, is being released, but the renal tubules are not responding to it. So that for that reason, sige man gyapon ang guwasong water naton class sa aton nga pasyente. So one of the problems in diabetes insipidus is that, again, it would go back to the problem that there is decrease of ADH. Now, class, if there is, there will be a decrease of your ADH. Class, look at the name of the hormone. The name of the hormone is antidiuretic hormone. In other words, class, antidiuretic, it tries to reduce your diuresis. It tries to reduce your urination. From that itself, pwede na kamo kaintindi kung anong iyang function, antidiuretic hormone. This time, nag-decrease ang aton nga antidiuretic hormone. So what happens to our patient is that there will be polyuria. Magambal ako class ng polyuria, sige lang ihi isang pasyente naton. And it could extend up to 12 liters per day. Okay, it could extend up to 12 liters per day. Okay, and plus that could be even up to greater than 250 ml per hour. Nga on the average, guys, 100 ml per hour is already average for an adult. In other words, class, the total for the day is around 2,400. But on these case students, it extends up to even to 12,000, no? 12,000 or 12 liters of fluids. So there's a lot of fluid going on. Now, plus, since sige-sige ang fluid natin nga nagagwa, what do you think will be the consequence on the part of the patient? Nagapolyuria ang pasyente. Okay, dehydration will be there. Let's talk about another P first. Kung nagapolyuria kita, anong pambawi naton class nga P sa polyuria naton? Another P class that would be able to compensate for the polyuria that you are having. So plus your patient would have polydipsia. So uhaw ang pasyente mo kay sige lang ihi niya nga ihi. Now question, ang problema naton in diabetes insipidus is that sige ang pangihi sa pasyente naton. If I will withhold guys the water intake of my patient, will it help reduce the urine of my patient? Class, if I will reduce the fluid intake of my patient, ma-reduce man bala nato ng urine output sang isa ka pasyente nga may DI? Come to think of it, di ba problema naton sa DI, sige lang ihi niya nga ihi. Tisubong, hawidan kong tubig. Let's say for example, I will reduce the fluid intake of my patient. Will that be able to reduce the urine output of my patient? Ideas on chat? Medyo lang ko naman para sa isa. Okay, class, may point si Mr. Dinogaling. Okay, maihi man na siya gyapon, class, kay wala siya ADH. So it does not solve the problem. If you will withhold the water intake of your patient, it will not solve the problem, class, that your patient would have decreased urine output or decreased urinary frequency. Okay, it would just lead to a problem na ma-dehydrate ang pasyente ninyo. That's why, class, the fluid status of your patient, one of the problem that you can have is that there will be dehydration. Okay, there will be dehydration on the fluid status of your patient. And because of dehydration, class, what could possibly happen on the GI tract? Will there be diarrhea or will there be constipation? Kaya may dehydration kita, anong common nga katabo, class? There will also be constipation to a patient with diabetes insipidus because of the lack of fluids. Now, when I will be talking about the weight of the patient, what would happen on the weight of the patient? Will there be weight gain or weight loss? Okay, class, there will be weight loss. There will be weight loss. Now, let's talk about serum osmolality. What would happen to the serum osmolality? Sige, ihi nga ihi ni pasyente. What would happen to the serum osmolality? Will it be increased or decreased? Okay, gaduha-duha kita kung ma-increase siya or decrease. Okay, class, here's what we need to remember. Serum osmolality, students, osmolality is a measure of concentration. Diba? It's a measure of concentration. And when I talk about serum, guys, take note na different ni siya sa urine osmolality, ha? So we are referring about the serum osmolality. So when I talk about serum osmolality, students, it refers to the bloodstream, no? Okay, or to the blood. Okay, blood problem of your patient. Okay? Okay, class, it would be a problem on the blood levels of your patient. Now, in this case, guys, sige ihi nga ihi sang pasyente. What do you think happens on the concentration of the blood? Will the blood become more concentrated or will it become more diluted? Sige ang ihi nga ihi sang pasyente. The tendency, class, it does, the blood will become more concentrated. The serum, I mean, will become more concentrated. With the serum becoming more concentrated, guys, what would happen? What would happen to the serum osmolality? Balik ako sa question ko kanina. Ma-increase ang serum osmolality or ma-decrease? Very good, guys. So the correct answer is that there will be an increase of your serum osmolality. Okay? There would be an increase of your serum osmolality. Now, let's go back again sa kadto kita kay electrolyte. Okay, electrolyte, class. The problem that you have in your diabetes insipidus is your antidiuretic hormone. Diba? You have a problem with your antidiuretic hormone. Sige ang gwa sang fluids naton. Fluids, class, keep on going out. Now, what primary electrolyte will be affected? What electrolyte would be affected? Okay, sodium. Okay, class, you will have your sodium. Okay, may nag-mention sodium and potassium, unahon tanay si sodium. What do you think will happen sa sodium levels kay sige ang gwa sang fluid? Will it be increased or decreased? Boss, damo gid ang nag-decrease, decrease. Okay, class, ADH. Balik kita sa ADH, ha. When I talk, class, about the function of ADH, what does it handle? Does it talk about sodium and water or water alone? The effect, class, is on the water only. Okay, remember, kang ginahambal ko aldosterone na mo to yung sodium and water. Si ADH nato niya subong, class, water lang yung effect niya. So kang gina, in your diabetes insipidus, since nubo ang ADH, the tendency is that the water will be going out, but the sodium would remain. So, class, for that reason, there is hypernatremia. Okay? For that reason, class, there is hypernatremia. Water keeps on going out, but then sodium remains. There is hypernatremia. Okay? Please take note of that. Now, urine concentration. What do you think will happen to the concentration of the urine? Sigigwa sang ihi. Will the urine become diluted or concentrated? Okay, so correct. The urine, class, will become diluted. Since the urine is diluted, what would be the urine-specific gravity? Would it be increased or decreased? Very good, class. Your urine-specific gravity would be decreased due to the dilution of your urine. Okay, take note class that the normal value of your urine specific gravity is playing at 1.010 to 1.025. Okay, that's the normal urine specific gravity. Now, vital signs. Okay, vital signs. Sige, ginuwa class ang tubig sa lawas naton. Primary vital sign that would be affected will be your blood pressure. What would happen to the blood pressure? Increased or decreased? Your BP class would decrease. So your patient would experience hypotension. Your patient would experience hypotension. And that is secondary, of course, to your fluid volume deficit. Secondary to your fluid volume deficit. Now, nagbaylo nga ito ng nursing diagnosis, no? Let's see. Let's analyze. Syndrome of appropriate. Okay, class. Diagnosis. Tama ba laning fluid volume excess under there is a diabetes insipidus, or should it be fluid volume deficit? Tama ba lain nga fluid volume excess nakabutang da, or bala dapat fluid volume deficit kita? Okay, so kindly correct that class. There should be fluid volume deficit. Okay, so fluid volume deficit related to the imbalance of your hormones as manifested by above symptoms. Okay, so kindly interchange. Okay, now drug of choice. Nagkulang kita ADH. So you give a substitute class to your ADH. You have your vasopressin, diba? Another name pag ika ni ADH is vasopressin. So you have an IV preparation of vasopressin. And plus you also have your DDAVP, your desmopressin acetate, which could be given sub-Q, IV, intranasal. It could be given TO. One of the adverse effect or adverse reaction to this drug is water intoxication. Okay, kung gamiton talang class, ang common sense naton kang ginakulang ang ADH. Subong class, dugangan nato ng ADH. By the time class na mag-overdose ka na naman sa ADH, it could possibly lead to the problem of water intoxication. Okay, sir, pwede man gali masubrahan tubig. Yeah, class, water intoxication, meaning there's too much fluid in your blood. And then class, one effect pagid sa water intoxication, because ng alterations ng osmolality sang inyong serum class, there is a tendency for cerebral edema. There will be a high tendency for cerebral edema. And then class, with your cerebral edema, you will have the altered level of consciousness. It will go back to your increased ICP because there is swelling of the brain. So you watch out for that. Ha? Kung naghahatag na sang DDAVP to a patient with DI, watch out naman kita nga basi ma-overdose naman siya. Now, let's go back, let's go to your SIAD, no? Or your syndrome of inappropriate antidiuretic hormone. As the term would imply, class, syndrome of inappropriate antidiuretic hormone, meaning na sobrahan siya class ang antidiuretic hormone. So this is a pituitary gland problem. It could be caused by your bronchogenic carcinoma. Class, in your bronchogenic carcinoma, there could be presence of your malignant lung cells. Class, anong pwede obrahon sa malignant lung cells? Trip lang nila class, ma-produce sila yung ADH. Okay? Usually class, it was found out that the malignant lung cells could synthesize and release ADH. Okay, they synthesize and release ADH. Another, trauma, stroke, and stress could all also lead to your syndrome of inappropriate antidiuretic hormone. Now class, basically, solion talang ni sila tanan. Kang gina may dehydration, the tendency for this time naman niya class, mag-hypervolemia kita. Kang gina may weight loss, subong class tendency naton weight gain. Kang gina class, ang serum is concentrated, subong what would happen is that serum would appear to be diluted, and because of that class, your serum osmolality would actually be decreased. Electrolyte, kang ginahambal ta sodium is increased, this time guys, your sodium would be decreased. And what you call to be a type of your hyponatremia as delusional hyponatremia. This is your delusional hyponatremia. Come to picture it like this, class. For example, this is your body. No? This glass of water would represent your body. The dots here are the salt in your body. And then class, this one is the normal amount of water, halimbawa. Now, if they will have syndrome of inappropriate antidiuretic hormone, what would happen is that there will be an increase of fluids. Pag nagdugang kita class ang fluid, pero ang amount ng sodium wala na tandog, it would appear, class, that there is a decreased amount of sodium in proportion to the fluids in the body. For that reason, class, your patient could have delusional hyponatremia. By the way, when I talk about sodium problems, what part of the body is usually affected? Okay, sodium. If I talk about the electrolyte sodium, what part of the body is affected? Other than the kidney. Kaya di ba, class, magambal kita potassium? Pag functioning sa potassium, mamroblema na ko kaagad kay heart. No, mamroblema ko kay heart. Pag sodium, anong alarming kung nga problema? Very good, guys. That would be your brain. Okay. That would be your brain. Again, class, because of the risk of cerebral edema that may possibly occur. Okay, that's also related to your sodium levels. Now, urine concentration. In syndrome of inappropriate antidiuretic hormone, haluson wala gagwa ang urine sa pasyente. So, class, the tendency is that the urine would become concentrated. What do you think, class, will be the color of the urine in syndrome of inappropriate antidiuretic hormone? Will it be amber, or will it be darker? What will be the color, class? Okay, the tendency is that it will be dark now. Okay, the tendency, class, is that it will be darker because, again, it's more concentrated. Of course, the urine-specific gravity, students, would be increased because of the concentration. And for your vital signs, class, you need to watch out for the increase of your blood pressure because, again, of fluid volume excess. Okay, fluid volume excess. Now, NVS, no? NVS, wala akong ginana-touch. No? NVS, class, is neurovital signs. For both of them, you watch out for neurologic problem. Okay, for both of them, you watch out for neurologic problem. Because of the imbalance of sodium, okay, especially, guys, in your patient with SIADH, because of the imbalance of sodium, kanina na-mention, Commander, may be a possibility of your cerebral edema, and then, class, with cerebral edema, kay ara tong ICP problems, and then you could even have seizure for that. Okay, seizure. Now, diuretic, you have your furosemide. What type of diuretic is furosemide? What type of diuretic is furosemide? You have 4 types of diuretics. Okay, osmotic, it's not osmotic. Very good, it's potassium wasting. Specifically, it's a loop diuretic. Okay, so you indicate that your furosemide is a potassium wasting diuretic. And then other than a potassium wasting diuretic, it's also a loop diuretic because it acts in your loop of Henle. Now, guys, tanawa, naghatag kita furosemide. Ang problema natin sa pasyente natin is hyponatremia. Okay? Class, when you would recall, no, kung i-recall yung actions ng isa ka diuretic, what does it do to your electrolyte levels? Does it increase or decrease your electrolyte levels? Okay, na-decrease ya. Class, maliban sa potassium na kaya i-decrease, class, ni furosemide, ang sodium levels natin, guys, kaya yaman na i-decrease. Kaya gina-excrete yaman ang aton nga sodium levels. That's why, sir, hyponatremia ang problema naton. Pagkatapos mahatag pagit kita, class, ng electrolyte, sang bulong nga posible maka-decrease. So, class, to prevent that, dapat magkuha gid kita, dapat may ara gid kita nga baseline levels sang aton nga electrolytes. You should have the baseline levels of your electrolytes. Ano ang reason, guys, na mahatag kita gyapon sang diuretic? Because of your edema, because of your fluid retention. Okay? Your loop diuretic is a potent diuretic in such a way that it may be able, class, to release those fluids na wala gagwa sa lawas natin. Okay? Galing bantayan nyo lang because of the side effect hypokalemia and hyponatremia. Now, your diuretic, class, furosemide is used along with fluid restriction if severe hyponatremia is present. Okay? Anong purpose, class, ng fluid restriction? Para, class, magbuhin ang amount ng water in the body, medyo mag-increase ang amount ng sodium. Okay? Then, class, you have your demeclocycline. Your demeclocycline is a drug that inhibits. Now, it's a drug that inhibits your antidiuretic hormone. Okay? It induces water reabsorption. It induces your water reabsorption. And then ang effect niya, class, of course, is that it would increase your urination. Okay, it would increase your urination. Now, this time, since ang pasyente natin, guys, may fluid volume excess, can my patient be helped by fluid restriction? Can my patient be helped by fluid restriction. Why na kung may makita nga sa bathaw? Okay? So class, diri sa pasyente naton class with SIADH, your fluid restriction is recommended. Kay kung hindi kita class mag-fluid restriction, ma-continuous kita class nga hypervolemia, pag tuloy-tuloy ang hypervolemia sang pasyente naton, what could possibly happen is that ma-increase ang cardiac workload. Pag class makapoy ang heart naton, that may result to cardiomegaly. And then class kung magdugay, pag kag magsigi-sigi ang cardiomegaly, what possible heart problem may result? What do you call that heart problem nga ang coping mechanism ni heart nag-fail man? Para na ganito no sa sentence. Okay, class, you have your congestive heart failure. Okay, congestive heart failure. Okay? So, amo na problema mo SIADH, pero look at it. It could also affect your heart. No? It could also affect your heart. So, for that reason, guys, gina-monitor man nato ng cardiac status ng pasyente because for the risk of congestive heart failure. And then neurostatus, as I have mentioned earlier, it could be related to your cerebral edema. Cerebral edema. Now, you have your fluid deprivation test. Guys, your fluid deprivation test is done to a patient, okay, just to confirm kung it is whether your patient is having DI or SIADH. But commonly class for DI. So ano ginaobra naton sa fluid deprivation test? Amo to bala kang ginapmangkot ko sa inyo nga kung di ta siya pagtagaan tubi magamay balaihi niya. So what happens? So class, gina-withhold ang fluids for 8 to 12 hours until about 3 to 5% of the body weight is lost. Tapos, i-weigh lang ang patient, closely gina-monitor ang weight ng patient, kag naga-plasma and urine osmolality status. Pero class once nga patient could feel the following symptoms, stop naton ang test. Kung may diabetes insipidus ang pasyente ta, as you have mentioned earlier, increased man gyapon ang urine output or wala gid class nag-increase ang concentration sang urine, nagstay siya class diluted even if the water is placed on hold. Okay, di ba supposedly class kung may dehydrated kita, ano obrahon sang lawas naton class? If you have dehydration, if kulang kita fluid, what would your body do? Your body would try to conserve water. Okay, your body would try to conserve water. Yeah, you're correct. Your body would try to have water retention. But class, if your patient would have DI, so this is the normal response. Pero class, kung ang pasyente natin may diabetes insipidus, baala, timo da, bisan ano timo ka dehydrated da, there will be no water retention that is happening. Because again, wala gani function ng aton nga antidiuretic hormone. Okay, that's for your fluid deprivation test. Okay, now let's proceed to the next set of disorders. That will be the disorders of your thyroid. Now, class, for your disorders of thyroid, they say, no, it's the largest endocrine gland. Your thyroid daw is the largest endocrine gland. I was thinking at first kung pancreas or liver, but then pancreas was big because of the exocrine function. Your liver is also big because of its exocrine function. So being an endocrine gland, class, the largest given sa endocrine to is your thyroid gland. So butterfly shape organ located in the lower neck, anterior to the trachea. By the way, what's the best position when I would want to assess for the thyroid gland? Where should the nurse be standing? At the front of the patient, in front of the patient, or at the back of the patient? Okay, so class, best for you to be standing behind your patient. Okay, so okay. Now, hormones produced. So you have your triiodothyronine, commonly class, kilala natin siya as T3. Then you have your thyroxine, which we commonly know as T4. And then you have your calcitonin for the negative feedback mechanism. Now, T3, your T3 class and T4 would have the same or almost the same function. Okay, so class, mag-promote sila sang growth. Okay, they promote skeletal maturation. Take note of that. That's why class, kung sa bata siya matabo, there is growth stunt. Tapos class, they also stimulate SNS activity. That's why kung masubrahan kita sa aton nga thyroid hormone, nagapitik ang duga, nagapalpitate ang pasyente. Pagkatapos class, it is also considered to be an insulin antagonist. Your T3 and T4 are also insulin antagonists. Okay, then they would increase the heart rate, of course, of your patient. Okay, that's the main function of your T3 and T4. Now, calcitonin. Si calcitonin niya, sila niya ni, okay, karon lang. Calcitonin class would affect the calcium. No? Calcium class, okay, it would affect the calcium. Ang ubrayan ni calcitonin sa calcium is that gina-decrease niya ang serum calcium levels. It decreases your serum calcium levels. Sino iya kontra guys? Sino ganing hormone nga nagapa-increase ang calcium levels? Okay. So ang iyang enemy niya versus ni sila yan ni PTH. Okay, versus ni sila yang duha ni PTH. Now, your calcitonin class would decrease the serum calcium levels. Your calcitonin is doing that by decreasing the osteoclastic activity. It decreases the osteoclastic activity in your bone. Guys, ka-discuss na musculo, wala pa. Wala pa, no? Kamusculo na kamo, wala pa. Okay, anaphila. Okay, so class. Remember, in your bone, you have your osteoblast and your osteoclast. What is in charge of bone breakdown? Osteoblast or osteoclast? Okay, very good. Okay, osteoblast, osteoclast. Isulat ng kuya ha, osteoblast, osteoclast. So class, your osteoclast is in charge of your bone breakdown. Okay, it would be in charge of your bone breakdown. Osteoblast, on the other hand, would be on bone formation. Okay, we could say bone formation. Now, class, if there is bone breakdown, what do you think happens on the blood calcium levels? Nag-break ang bone, ano matabo sa blood calcium levels? Okay, isa na sa panumdumon natin ha, basta sige ang breaks ang bone class, there will be an increase of your blood calcium levels. Okay? Now, in the case class of your calcitonin, kung na-notice nyo, ginapanubo yung osteoclastic activity para hindi magdamo ang calcium sa bloodstream. Okay, para hindi magdamo ang calcium sa bloodstream. It also class decreases the absorption of calcium in the GI tract. It also decreases the absorption of calcium in your GI tract. So again, class, calcitonin, gapa-decrease siya sang serum calcium levels natin. Now, negative feedback mechanism. So the same kang gina, no? Naka-mention man kita sini. Whenever class your T3 and T4 would decrease, for example, your TSH students would increase. So your TSH class would be released by your pituitary gland to tell your T3 and T4 that's about time for them to work. Plus, you also have your TRH. So your TRH is the one released by your hypothalamus that would trigger class your anterior pituitary gland to release your TSH. However, class, decreased temperature would affect the release of your TRH because we've mentioned that hypothalamus is the thermoregulatory center of our brain. Now, etiology. Okay, pinakita, hypothyroidism na tagali, no? Ay, sorry na utod. So you have your hypothyroidism. Class, for your hypothyroidism, damo kita tawag sina, class among adults, tawag natin myxedema. Okay, pero class kung matabo siya class in children, pwede natin siya tawag na cretinism. Okay, for your children, you have the term there, cretinism for your children. Anong possible nga reason sina? You have your autoimmune disease. Okay, autoimmune problem that would destroy the thyroid itself. Then class, you have your surgical removal or your thyroidectomy. And then you have the therapy for hyperthyroidism. Ibig sabihin, class, ang pasyente ko may hyperthyroidism, tapos class, sige hatag ko sang bulong, because ang paghatag ko class ang bulong, ang ini nga pasyente ko man is having problems, nagtama naman class kanubo ang functioning sang iya nga thyroid system, okay, or thyroid organ. So, that's one side effect class of your management for hyperthyroidism. Now, there are several types, no? May types kita sang hypothyroidism. Primary, secondary, tertiary. O class, when I say primary hypothyroidism, anong organ ang affected? Pituitary, the thyroid itself, or hypothalamus? Class, the problem is the thyroid itself. Okay, the problem class is the thyroid itself. Now, secondary, maghambal naman ko secondary, din ang problema ta sa tatlong agin mention. Okay, your problem will be your pituitary gland. Okay, pagkatapos class, you have your tertiary. For your tertiary, your problem would be, bago na mga shortcut, mga pit gland. Okay, class, for your tertiary class, your problem will be your hypothalamus. Okay, you'll have your hypothalamus. Okay, So, ma-decrease aton T3, ma-decrease aton T4, may possibility man nga maapektuhan ang aton nga calcitonin. Okay, so there is a effect to your T3, T4, and calcitonin. Ay, dali lang ha, balik ko danay sa types. Primary, secondary, tertiary. Kung tanawon ko class, sino ay ang congenital? Primary, secondary, or tertiary? Okay ha, so dugang naton, nga primary class is usually associated with congenital problems. Pagkatapos class, ano nagkulang? What macronutrient or what nutrient ang wala nato na take na kinahanglan tani ni thyroid para maka-function siya properly? Very good class, iodine. Okay, iodine. O let's say for example, may pasyente kita nga hyperthyroidism. May pasyente kita class sa hyperthyroidism iya masakit. Now, we have been managing the patient with PTU, propylthiouracil. Natamaan siya class ang PTU, nagka-hypothyroidism siya. Ano ang klase ng hypothyroidism to? Primary, secondary, or tertiary? Secondary. Sir, kasi basi secondary to the medication. Okay, class? Okay. Daw to nga ang buto. Taklas sa bunga election now. Okay, class, so you would have primary. Ha? Primary because this hypothyroidism is directed to the organ itself, the thyroid. No? Okay, kinstop niya ang thyroid class sa production niya. So it's referred to as it's referred to as primary hypothyroidism. Okay, now going back to assessment. Manubo si T3, manubo si T4, manubo pagid si calcitonin. Class kay manubo si T3, what would happen to the metabolic rate? Ma-increase or ma-decrease? Okay, decrease class, no? Masubo niyang hypothyroidism. Decrease man ang metabolic rate. T4 natin guys. For the T4, what would happen? Okay, ano matabo class sa body heat production? Ma-increase or ma-decrease? Hindi na ako sure kung ma-agree ko di sa decrease or kang ginapan nga pamangkot kung masabat. What would happen class to the body heat production? Okay, there will be a decrease also of your body heat production. That's why one of the sign and symptom of a patient with hypothyroidism is what you refer to as your cold intolerance. Okay, there is what you call your cold intolerance. Very good capture. Cold intolerance. Okay, class kung tanawa na ba lang mga signs and symptoms na nakalista sa dalog? Okay, hyponatremia, hypoglycemia, hypoventilation, hypotension, tanan class nubo. Okay, kay again kang ginanag-mention kita nga ang inyong T3 kag T4 has something to do with the sympathetic nervous system. Class, ano ganing sympathetic nervous system? Ano ganing tawag na nga response? When I talk about your sympathetic nervous system, what type of response? Okay, you have your fight or flight response. So class, isipon nyo lang, kung tamaan kataas ang inyong thyroid hormones, there will be fight or flight response. But this time, since you have hypothyroidism, nubo. Okay? Tanawa, nagdubo ang aton nga glucose, nagdubo man aton nga breathing, nagdubo man aton nga BP, nagdubo man aton nga heart rate, nagdubo man pati aton nga temperature. Okay, class, because it's not the sympath system which is working. Now, calcitonin, nag-decrease ang calcitonin. Kay nag-decrease ang calcitonin class, anong pwede matabo sa calcium levels? Okay, class, there will be an increase of your calcium levels. Okay? Kag, kung maghambal ako class niya calcium, if heart is to potassium, brain is to sodium, anong masabad kay calcium? Anong masabad kay calcium class? Once na maapektuhan si calcium, bones, okay? Okay, maliban sa bones. So, nanamian ako sa naghambal nga heart man, may question mark lang galing. Okay, class muscles. Okay, muscles. So you will have a problem with your muscles. Irritability. Okay, class, what happens is that there will be decreased, no? There will be decreased muscular irritability. Okay, decreased neuromuscular irritability in the presence of your ano na ning agi ko. There will be decreased neuromuscular irritability in the presence class of your hypercalcemia. Okay, tandaan na natin. So basta class calcium, muscles. That's why I accepted heart earlier. Okay, so these are the signs and symptoms that your patient may have. They would also appear weak, plus because of the decrease of your T3 and T4, decrease ng basal metabolic rate, so lethargy.
lethargy na una-una class, tapos somnolence, patulog-tulog, tugay-dugay kung pabayaan mo, there will be stupor, there will be coma. Okay, there will be stupor, there will be coma. Common nursing diagnosis for this patient, they may have activity intolerance. Okay, they may have activity intolerance. Then class, they may also have, kung mag-progress ni class ang tanan mo nga hypo, they may also have ineffective tissue perfusion. They may have ineffective tissue perfusion based class on these findings. Okay, so anong plan natin? Check ang changes in heart rate, class kag rhythm. Kaya kung magsigi-sige ng bradycardia, arrhythmia, heart problem, monitor the weight of the patient. When I will picture somebody with hypothermia, what do you think? Somebody, I mean, with hypothyroidism, will the weight be increased or decreased? Class, kung tulukon ko somebody with hypothyroidism, okay, they're actually having weight gain. Okay, common to them is that they would have weight gain. For that reason, guys, kinapa-low fat diet natin sila kag low calorie diet because your purpose for this one is to prevent the occurrence of your obesity and to prevent class the occurrence of your hyperlipidemia. Okay, the increase of your fats, no, or your cholesterol. Now, your patient may also possibly have constipation. Ari class ang tandaan ninyo. Kaya di ba class maghambal kita SNS or maghambal kita nga sympathetic kag parasympathetic, we sometimes say simpa. Ay di na to, simpa. We usually class say all is up, no? Okay, we usually say all is up except GI. Di ba kaysa simpa naton class ang common nga manifestation is dry. That's why your patient would usually be said to have constipation if ang simpa naton ang matamaan. Now, students, the case is different when you are dealing with thyroid problems. In thyroid problems, guys, kung nag-hypothyroidism kita, class, kung nag-hypothyroidism kita, naga-decrease ang heart rate, kay ginpahina si simpa, naga-decrease ang BP, kay nagahina si simpa, pero class at the same time, students, naghinay ang your patient's GI tract would have slow movement, so there will be constipation. Okay? Pati ang GI niya, class, naghinay. Okay? Kaya kung kakaroon ba i-think nyo bala, nga kay nag-decrease ang simpa, you might be thinking, diba si nagparasimpa siya nga response. Kag kung magparasimpa kita, class, nga response, ang GI nato naga-increase. But that's not it. That's not what's happening in your thyroid problems. Okay, all of them will be down in your thyroid problems. So decrease heart rate, decrease BP, class, and then class, there will also be a decrease of your GI functioning. Okay, now with that being said, constipation will be one of the problems of your patient. Kaya nagka-constipation aton pasyente, what would be increase in the diet? Very good, class, you increase the fiber, and you can also increase, other than the fiber, okay, oral fluid intake of your patient. Somebody has already mentioned water. Okay, oral fluid intake of your patient. Now, thyroid replacement drugs. Ang ginatandaan ko lang niya, class, levothyroxine. May thyroxine, meaning class, gina-replace siya kulang ang thyroid hormone. So levothyroxine, you have Synthroid as a common medication. Now, class, how about if may anti-hypertensive, no? Nadiskubrihan mo ang pasyente mo, class, subong lang na-diagnose na may hypothyroidism. Pagkatapos, class, may ara siya anti-hypertensive. What do you think? Continue tang anti-hypertensive medications or do we need to place it on hold? Panumdom. Hold the class. Kay hypothyroidism, nagapanubo BP, anti-hypertensive, nagapanubo BP, closely monitor danay ang BP, class, before mo i-go on. Temporarily, class, you're placing it on hold. Cardiac medications. You have cardiac medications that decreases the heart rate. Name a cardiac medication, class, that decreases the heart rate. Cardiac medication that decreases the heart rate. 5, 4, badog-gadugay guahaw. Okay, digoxin. So you have your digoxin. Your digoxin is considered to be a cardiac glycoside. Okay, it's a cardiac glycoside. Your digoxin, class, has a negative chronotropic effect. No? Negative chronotropic effect, which means it decreases your heart rate. Kung may pasyente natin class may digoxin, tapos may hypothyroidism siya, we need to place digoxin on hold first. Okay? Because class your patient may be at risk for a severe bradycardia. Okay? Yeah, lanoxin is actually a brand of your digoxin. And then class, once you're having your patient on treatment of thyroid replacement therapy, you need to watch out for signs of hyperthyroidism. Kay basi masubrahan naman siya class ng thyroid replacement therapy. Now, you have the term myxedema coma. Plus, your myxedema coma is, let's say, it's a severe form of your hypothyroidism. What do you think will happen in these vital signs? Temperature, guys. Temperature would be increase, decrease. There will be a decrease of your temperature. Pulse rate class would also be severely decreased. Respiration class will be severely decreased. BP will be severely decreased. CBG, blood sugar. Hambal ta kang ginang T3 kag T4 nagabulig sa blood sugar levels. What do you think will happen in myxedema coma? Ga-increase siya class. Plus there will be severe decrease still of your blood glucose levels. Diba, hypothyroidism, takang gina-hypoglycemia na. Sa myxedema coma, class mas nagalala pag ito siya. Neurovital signs class would also have a tendency to be decreased. And then your blood sodium levels would also be decreased. Okay? So class, for the plan of care for these patients, it's also the same with the management of your hypothyroidism. But this time, class, you need to consider primarily the airway problem of your patient, because class, tanawa, may problema ka na sa respiration. And then class, you need to check on the level of consciousness of your patient, because as the term would imply, you have myxedema coma. Okay, there's an occurrence already of coma among these patients. Okay, so that could possibly be closely monitored among your patients. Now, hyperthyroidism. So basically, class, suli lang siya sa hypothyroidism. Common risk factors that you have is you have your Graves' disease, which is your toxic goiter syndrome. So students, for your toxic goiter syndrome, this is common among female, those less than 40, autoimmune disorder with those descriptions indicated there. Now, it could also be caused class by one there that is indicated, siguro send out is toxic multinodular goiter. As the term would imply, multinodular, meaning damo siya class nodules. And then another class is exogenous hyperthyroidism. Magambala ko class niya exogenous hyperthyroidism, sila ni class ang pasyente ninyo nga hypothyroidism na sobrahan replacement. Okay, na sobrahan replacement. So this is related to excessive use of medications. So you have increase of T3, increase of T4, increase of calcitonin. Kay class nag-increase ang T3 kag T4, ano matabo sa metabolic rate? Very good, it would be increase. Nag-increase si calcitonin, ano matabo sa calcium levels? Nari naman class, ma-decrease naman ang calcium levels. Okay, may hypocalcemia na kita. Kung hypocalcemia, guys, ang ginaistoryahan ta, ano gani ang duha nga sign sang hypocalcemia? What are the two signs of your hypocalcemia? Isa class na umpisa sa letter C, isa class na umpisa sa letter T. Okay, you have your Vostek sign and then you have your Trousseau sign. Okay, you have your Vostek sign and then you also have your Trousseau sign. Salamat, nagtulok man ko sa inyo gin-type ko ng spelling sa Trousseau. Okay, so class you have your Vostek and then you have your Trousseau sign, which are class indication of increased neuromuscular irritability. Imagine itap lang ya class ang imo nga cheeks, naga-irritate na siya, naga-twitching because there is increased neuromuscular irritability. Then hypermetabolism, increased sympathetic response. Kaya ang T3 nyo class kag T4, kuliton yaman na si epinephrine, ipa-increase yaman ang function ni epinephrine, ipa-increase yaman class ang function ni norepinephrine. Okay, that's what's happening in your hyperthyroidism. So assessment, luga katabo, increased metabolism. Kay increase class ang metabolism niya class, sige man nakaon nila, increased appetite, no? Increased appetite. Pero class, despite the increase of appetite, these patients are still experiencing weight loss kay tamaan gid kataas sang metabolic demands sang body. Ang ginakaon niya class, sige lang gyapon utilize sang body. And then, kung cold intolerance to kangina, si hypothyroidism, this patient class would have heat intolerance. This patient would have heat intolerance. Na, kay heat intolerance class, they would initially appear to be hyper. Hyper na sila class, tapos later on, they would have fatigue. Okay, kapuyon man sila. Now, because of hypocalcemia, the peristalsis class would be increased. There will be increased peristalsis as indicated in your handout. There will be class a problem with the hair. It would become fine and silky, and then the nail would become pliable. Now, I mentioned that there will be activation of the sympathetic nervous system and even the central nervous system. Tachycardia. If pabayaan natin guys ang tachycardia, it could result to a more severe form, which is your supraventricular tachycardia. If pabayaan siya natin class, it could lead to your ACS. What is ACS in cardio? ACS. And then kung pabayaan ko siya, would lead to MI class, okay, and your patient may even manifest with angina. For that reason, class, you need to monitor also the ECG of your patient in hyperthyroidism. Yes, that is your acute coronary syndrome. Taas ang BP, tapos class daw ka nervyosa. Nervousness, anxiety, and restlessness, decreased attention span, and then fine tremors. Fine tremors. Then class, your patient would have exophthalmos or the protrusion of the eyeballs. Your protrusion of the eyeballs would have a tendency to be irreversible. Okay? It would have class a tendency to be irreversible. It is actually caused by the presence of fluid deposits. No? Mga fluid deposits na siya actually behind the eye that occur class in a patient with hyperthyroidism. Okay? Fluid deposits behind the eye. Have a tendency to be irreversible. Ang budlay na class kay guan sila doon protrude gid ang mata naton. So ang problema mo na class is that ang cornea sang pasyente nimo may have presence of ulcerations. Okay, may have presence of ulcerations, may corneal dryness na una-una, ma-dry siya tapos mo ulceration. Then you may have inflammation there. So what are our plan of care for this patient? Daily weight, non-stimulating kag cool environment kay gamay lang nga init mapala mahulay sila. Provide them rest periods. And this time class low fiber diet. Nga low fiber diet because your patient class may have constipation or diarrhea. Tendency class ang pasyente naton subong is diarrhea. Kaya nagadiarrhea si patient tatanawa ara naman si fluids kag electrolytes. Now, nag-decrease si calcium, so mahatag kita calcium replacement. By the way, class, calcium replacement is a high alert medication, no? So class, what the replacement for that is calcium gluconate. Okay, calcium gluconate, IV. Now, hambal ko high alert medication siya. Ano nga antidote i-prepare ko? In case na ma-overdose ang pasyente ko or mag-react siya sa calcium gluc. What antidote should I prepare if ever I'm giving calcium replacement? Guys, antidote for calcium, 5, 4, 3, calcitonin, okay? Wala ko to nasagang calcitonin pero may punto man, di ba? Yes, class, there's actually calcitonin, no? You have calcitonin tablet. I think it's coming from salmon, if my memory serves me well. Salmon calcitonin, it's coming from the fish salmon. Okay, but class, the answer that I was expecting is magnesium sulfate. Okay, the antidote that you will prepare is your Magsul. Okay, ibig sabihin class, bisan decrease ang calcium sa pasyente ninyo, kag maghatag ka mo class ang bulong, that will be depending on your agency. Ha. There are hospitals here in Iloilo that would not allow nurses to administer calcium gluc and magnesium sulfate because they are high alert medications. Usually class, mag-administer ko sina, gatupad ko cardiac monitor, and then I'm closely monitoring class the, what do you call this? Closely monitoring the cardiac rhythm of your patient. I'm watching out for sinus pause. Okay, sinus pause. Kung di class ma-recall niyo ang PQRST niyo, okay, may PQRST kita. Ang tendency ya class kung magdasig-dasig ka lang hatag sang calcium gluconate, ma-pause lang na ya class. Okay? Ma-pause na siya tidugay. So, you need to watch out for sinus pause or sinus arrest. Because your calcium, as mentioned earlier, has an effect on the muscle, and then because of that class, your heart is also affected. I delayed ang akong drawing sa screen. No? Doon namin kita yung akong drawing. Now, let's proceed. Where are we? Safety class. Avoid caffeine. Kaya remember, So class, among your patients with hyperthyroidism, we place caffeine on hold because class, SIMPA is triggered. If dugangan pa natin sang caffeine class, kudugo ng pasyente nyo sang palpitations. And then class, that's not teras. You administer your artificial tears. Okay, ano naman sa tears versus tears. Plus, you administer your artificial tears because your patient, again, would have exophthalmos. And then exophthalmos could lead to drying of your eyes. Okay? Now, hyperthyroidism kita, so gahatag kita anti-thyroid medications. Pinaka-common gid class, PPU kag methimazole. Okay? Side effect, adverse effect, agranulocytopenia. In other words, class, ano ga katabo sa immune system? Naga-increase siyang response or naga-decrease? Class, the immune response would be decreased. Naganubo, no? So your patient would be at risk for infection. Okay, so balantayan naman natin for infection. Na, plus actually kung short-term therapy, hindi man na, but the tendency is that your patient would be on long-term therapy. Then plus you have the anti-thyroid medication, pagyed nga iodine therapy. Kang gina, kung na-recall nyo, kag kumadumduman nyo, iodine is actually parang vitamin, quote and quote, nga matawag natin for our thyroid. But look at this time. In hyperthyroidism, we are using iodine. No? We are using iodine to manage hyperthyroidism. Now class, iodine therapy, you have your strong solution of potassium iodide, that is your SSKI. Then you have your Lugol solution. Class, they inhibit the release of your thyroid hormone. Okay? Amo ni class ang ginatawag nila nga Wolff-Chaikoff effect. Okay, this is your Wolff-Chaikoff effect. This is an autoregulatory phenomenon wherein the large amount kuno class of iodine would acutely inhibit or stop the thyroid hormone synthesis. Diba? Balta, iodine is actually needed by our thyroid to perform its function. But this time class, kung tagaan ta siya students sa high concentration of your iodine, the tendency is that it would stop the function acutely. It would stop the function of your thyroid. That explains class nga gahatag kita iodine dire kag your Lugol solution is also made of iodine. Now, it says here class not palatable, hindi siya class manamit. Katulad choice ang pasyente mo, immune niya na. Kay kilanlanon niya. So class, anong ito recommendation? Mix lang natin class with water, basta maubos niya. If not class, you ask the doctor, you could mix it with fruit juice. Class, and then provide drinking straw. Nga class, nga pa-provide kita drinking straw that would reduce the amount nga matilawan sa pasyente natin. Okay? Now, if we would be using a radioiodine or radioactive therapy class, which is your iodine 131, that's already radioactive, class your patient is placed on isolation, and then whenever class you're handling the patients, you need to handle the body secretions with gloves. Then no pregnancy up to 6 months after therapy. Now, beta blockers, calcium channel blockers. Ano ang general term ni sa ila? What is the symptom na i-address nila? Sige nga, beta blockers and calcium channel blockers. What's the general symptom on your hyperthyroidism that it could address? Ano na ganit sila class? Ang beta blocker kag calcium channel blocker, they are anti-hypertensives. So they will be the one to address class the sympathetic excitement kanina. They will address your hypertension. Give me an example. Give me an example of a calcium channel blocker. Beta blocker, yung class, ulol. That will be your beta blocker, no? Metoprolol, propanolol. Give me an example of a calcium channel blocker, guys. Give me an example of a calcium channel blocker. Wala daw mahina yung atong calcium channel blocker. How? Okay, class, so you can have your amlodipine. What else? Okay, very good. You have your diltiazem. Okay, diltiazem class, and then may isa pa gid. Very good, verapamil. Okay, ang pinaka-common class na ginagamit in an emergency setting is your diltiazem and verapamil. Ang amlodipine naton common na ginagamit ng maintenance medication. Now, surgery, you need to do your thyroidectomy. Pwede nga total, pwede nga partial. So you can have class your comfort measures lang kita dira. Tapos class, you need to have your pre-op care, so comfort measures. Then you need to teach your patient on the proper positioning. No? Then class, you need to, wait lang. Pre-op care. I think nautod. Kaya ang comfort measure, support neck, and head and pillow, daw post-op care na niya. Ano guys ha? So this one is post-op care. I know sa handouts nyo, wala na yan na utod. Now for the pre-op care class, no? Sa pre-op care, tudluan ta na pasyente ta deep breathing. Tudluan ta man pasyente naton sang coughing exercises. Tudluan man naton aton pasyente class sang turning, and then tudluan naton pasyente naton sang neck support. Okay? Remember class that the opportunity to teach your patient properly is on the pre-op stage. Tapos class, on the pre-op stage, you also administer your Lugol solution and then your propanolol and then your dexamethasone. Okay? So administer lang class these medications. Now, you have your Lugol solution. Students, excuse me, I am taking a call. Interruption. So in the case of your pre-op, you need to administer the following, no? So you have your Lugol solution, then you have your propanolol, and then your dexamethasone. Now class, if you will be asked, what is the purpose of administering your Lugol solution pre-operatively? Guys, the purpose of that is to reduce vascularity. Ang purpose ng students is to reduce the vascularity of your thyroid. Okay? Why is that the case, guys? Whenever you are dealing with thyroid, it's on your neck, no? Sa neck na siya naton. So class, your neck is highly vascular. If an operation would be done there, bleeding would ensue. So class, gahatag anay Lugol solution para ma-reduce ang vascularity, and then class, the effect of that will be to reduce your hemorrhage. Okay, the effect of that will be to reduce your hemorrhage. Propanolol is given, of course, to control the blood pressure, and then the dexamethasone class, dexamethasone is a steroid. As a steroid student, it could also inhibit the action of your thyroid hormones. It could inhibit the action of your thyroid hormones. Post-op guys, position. Importante ang pasyente is maintained in semi-Fowler's position. Okay? Ang head kag neck niya class dapat neutral position. Magambal ako class na neutral position, dapat tadlong ang ulo niya kag liog. Okay? Or else class, your patient would be at risk for complications and bleeding. Hindi kita class pwede mag-hyperextension, that is not recommended because that would increase tension on the suture sites sa gintahian. Hindi man class pwede nga mag-flexion because again, that would increase tension on the suture line. Pag mag-increase class ang tension sa suture line, that would result to bleeding. Okay, that would result to bleeding. Okay? Now class, maghambal bleeding, one time nagwa ni sa board exams, monitor class dapat ang bleeding sa anterior kag sa posterior. Ano namin class ang posterior, ang iba na numdum, ti wala man na madugo sa likod, kaya ang thyroid sa tubang manayagin kuha sa liog. Nga monitor ako class sa posterior. Because class, the tendency is that ang pooling sang blood, ang gamay-gamay nga blood class na nagaguwa, pero sige-sige class ang flow niya class, the tendency class is that dira siya ma-pull sa likod sang liog sang aton nga pasyente. It would pull class sa likod sang liog sang aton nga pasyente. Okay? Now, you also class watch out for respiratory distress on the part of your patient, and then you watch out for laryngeal spasm. Class, ano matsyag yung reason nga ang pasyente naton mag-laryngeal spasm? Ano ang reason nga ang pasyente naton class mag-laryngeal spasm? Excuse na ko liwat. Okay, so class, what could be the reason why this patient would have laryngeal spasm? Irritation of the vocal cords? Yes, possible. Pero kanami gid sang sabat class nga possibly due to hypocalcemia. Okay? Class, laryngeal spasm could be caused by your hypocalcemia. Now, thyroid ang aton ginoperahan nga nagka-hypocalcemia kita. Nga nagka-hypocalcemia kita nga thyroid ang aton ginoperahan. What nearby organ could have been touched during the operation? Very good class. Your parathyroid hormone or your parathyroid gland, your parathyroid gland could have been inadvertently touched. Okay? Inadvertently or accidental removal of your parathyroid. Very good class. And for that reason, okay, you assess for your tetany. Okay, you assess for your tetany. Dira na kita class mabalik sa Vostek sign, mabalik kita sa Trousseau sign. Okay, tetany class which is characterized by tingling, and then you would even have your Vostek sign, and then you would even have your Trousseau sign. Okay, these are the signs na common. Now, assess for nerve damage. So kung ginalagambal ka mo nga, it could be the nerve damage also, that's correct. So ability to speak, no tone and quality of voice. Kung mild hoarseness lang class, okay lang, expected lang may mild hoarseness bago lang siya ginoperahan. Pero class, pag mag-severe ng hoarseness of voice, inform the physician because it could have been a laryngeal nerve damage. Possibly class na during the surgery, the laryngeal nerve could have been damaged. So right away, call the doctor. Because class, it could all result to the following: respiratory obstruction, dysphonia, okay, high-pitched voice, dysphagia, restlessness. These are all signs of your laryngeal nerve damage. Okay, these are signs class of your laryngeal nerve damage. Kang gina students, kung si hypothyroidism naton may myxedema coma, si hyperthyroidism naton class na naglala would have thyroid storm. Okay, your hyperthyroidism nga naglala would have thyroid storm. Then class, common nga problem ta dire, okay? Surgery. Area class another naman niya natabo, no? Nag-surgery, may gin-attempt ka kwaon near the thyroid, tapos nag-excited ang thyroid, nag-over-release siya sang thyroid hormones. So there is increased release of thyroid hormones. Okay, isa na ka pwede matabo. Now class, now siya vomiting diarrhea, isa kabalantayan nyo sa thyroid storm is your dehydration. It could be possible class that your patient may have dehydration. Now it's a severe form of your hyperthyroidism. So airway, cooling blankets, antipyretics, ice packs, and then class, most of your medications will already be administered IV. Okay, most of your medications will be administered IV. Now, signalang thyroid cancer. Plus, for the thyroid cancer, oftentimes they manifest with signs and symptoms of hyperthyroidism. But there will be instances man, may mga cancer man class na nag-manifest ng hypothyroidism. Okay, so as you can see, women under the age of 55, it could be because of radiation, it could be the assessment, it could be class because of the radiation of head, neck, and chest. No? And then usually it's a lesion that is hard. Class basta hard lesions, basta class lesions nga wala gahulag, basta mga masses nga wala gahulag, there is a high tendency students that this lesion is malignant. No? Malignant. So what is done? You do your needle biopsy. Then you have your also ultrasound of your neck. Now for the procedure, you can have class your total or near total thyroidectomy. If mas severe siya class nga condition, okay, for your procedure, you can have your modified neck dissection. You can have your modified neck dissection, students, or more extensive radical procedures, which would involve the use of your modified neck dissection, guys, or more extensive radical neck dissection. Hindi ko di siya gali makita in a while, ha? So assessment, lesions, needle biopsy, imaging studies. So for your DPIE for this part, so for your diagnosis to implementation to this part. Plus, for dissection, it's commonly done, students, if there's already involvement of your lymph node. Okay, this is done if you have involvement already of your lymph nodes. Okay, so medical management. So you have your radioactive iodine still to use for thyroid cancers with metastasis. So the route of administration is oral or pwedeng external administration by radiation therapy. Short-term side effects are indicated there. And patients who receive external sources are at risk for mucositis, dryness of mouth, dysphagia, and redness of the skin. Then plus, since may ara kita removal of the thyroid gland, you would need to have your thyroid hormone replacement. So it's given after surgery, students. It's given after surgery to maintain a normal thyroid state. And then plus thyroxine, okay, hormone replacement is required for a lifetime. No? If it was found out that there is inadequate thyroid function after surgery. Guys, nagahambal ako inadequate because when I say thyroidectomy, it does not mean that all the part of the thyroid will be removed. Some part of it actually remains, no? Especially pag partial siya nga thyroidectomy. So tanawa na class after surgery, kung okay pang functioning niya, okay, you don't need to have the lifetime na replacement. But if there's a problem with the functioning, then you need to have the lifetime replacement of your hormones. Okay, I think we will end the day with that for this time. And then we will discuss next time your parathyroid. Then after the parathyroid, you have your adrenal glands and then your pancreas, which would be talking about your diabetes mellitus. Okay, thank you very much, guys.